be the food, solid food, or voluntarily we are avoiding some particular things, maybe there's some particular foods or only for the liquid fast or semi-solid or what we call for the mono diet. Like one fruit, especially on that we used to do for the fasting. So complete abstinence is like some people, it might be for the combination of just for the few duration. So I will tell about that for the types of fasting. So I'll go through for the intermediate fasting for today's topic. So as a naturopath, we use fasting as a detoxification, because internal detoxification, whatever morbid matters or foreign matters or any toxins inside the body, what we call for encumbrance. So in this way, we have to take out as a detoxification, we use fasting is the first line therapeutic method. So in that, we used to tell fasting is our surgery method for naturopaths, which like without the scalpels. So in type intermediate or periodic fasting, so in intermediate 16 is to 8 means in 24 hours, 16 hours fasting, or in periodic 2 to like 21 days of fasting. So that's we consider for the periodic fasting. So what effects it comes when we start the fasting? So first one is for like a glucose to the ketone switch. So in that time, it reduces the glucose and insulin like a growth factor 1. It will be like a reducing an insulin and glycosins, and it will be increasing the fatty acids and ketones. Okay, metabolism will be increased in that time. This will be the end product of that. And cell repair, like regeneration of cell, it will be increased in that time. And lipolysis, what we mostly consider to reduce the fat and all. So this will be increasing while doing the fasting. And cellular resistance or autophagy, what we used to speak from the 2016 regarding who got the autophagy, that Nobel Prize. So we are speaking what is autophagy, like scavenging or destroying the more like which is not needed inside the body. So it is scavenging by itself. So this method is like, it is the effect of fasting, normal fasting, what we are doing. So this is the physiological process. And next one is the refeeding. So in refeeding ketones to glucose switch. So in that time, increase the like a cell regeneration. Then metabolism, whatever metabolism it has reduced, it will be regenerized in that. Detoxification of the enzymes, whatever extra morbid matter or any metabolites, like a dysbiosis type also, it will be detoxifying in that. So after that, like what periods, what we consider after those production of the ketone bodies or refeeding or glucose, glycogen things. So first one will be like if we fast for more than 14 hours, so it start depletions. So first thing, like 4 phases will be there in the fasting. So body to like start burning the fats in the time, and blood sugar and carbs, it will be dropping after, like if we fast more than 14 hours. Then rapid loss of like fat by fasting to 14 to 20 hours per like what duration we are giving for the intermediate fasting. So it will be starting depleting of fats. And what it was storing, it will be starting more depletion after the 24 hours. And progress slowly, it will become slower when it is crossed more than the 24 hours. It's up to 38 hours. But whatever we are considering for the fasting therapeutic, it should be under the supervision. So it might happen any adverse effect, so it should not be deplete anything further on. So detoxification process, it's like toxins what we like metabolize or end product or debris what it was there in the phase 1. So after that, intermediately metabolites, it will be considering for the phase 2 for the excretion. So first thing, whatever was stored in the fat or whichever in the lymphatic system, it will be draining out through the like or the serum, like it will come to the kidney for the filtration as urine or fecal matter. And this is the self-protecting mechanism against oxidative stress. So it is showing for the nuclear factor which is reacting for that. It will be increasing in that time. So it will drops out whatever the myocardial like infection which can cause the infection, or it can intermediate other disease or hormonal changes. It can be reduced by fasting. And what ketone is the end product when we are going through about the fasting. So what are the benefits when it is producing ketones? First thing will be like improve the like whatever we have the control of stimulation or the brain system or neuron or cognitive function, it will be increased and improve the brain health and blood sugar control and reduce the hunger. We already know about the ghrelin, leptins hormones which is regulating our hunger or satiety center, what we call like which is controlling. So it will be balancing, or when we start a fasting it will start increasing the satiety hormone. And this is the thing what we used to speak in the autophagy. So self-dividing of the cells which is unwanted or it having any abnormalities in that, so it will be starting eating of itself. So in that feeding and fasting time, when we are making growth for the cells. It may be for the normal cells or abnormal cells. So when we are doing fasting, in that time whichever is needed for the normal cell, it will be having supply of energy, but other junks which we are not having, it will be cleaning up those debris. So we all know who is this person who got the Nobel Prize for the autophagy in 2016, right? So major health benefits of autophagy, already I told about whole this cognitive function, even the nervous systems, and giving relaxation of our gastrointestinal tract. So it will be giving more sustain for the like whichever has the already drains out the energy or some gastric effect which is having the inflammation or anything irritants, it will be giving relaxation for that. And other system which is has to reduce by the insulin, which after the fasting it will be reduced. Insulin sensitivity will be increased, insulin resistance will be start reducing in this time. And these are the intervention which we have seen in the autophagy which has increased. Okay. So in intermittent fasting, when we consider that we don't like really tell about which food we need to take in that, but most of the people, like we can't consider every time for the therapeutic fasting, because most of us are working or some are busy in their schedules. So what according to them they can consider for the intermediate fasting according to their like menu planning or time schedules for the work. So when we are breaking off the fast, we should not be having anything like spicy thing we used to consider. But starting, we have in naturopathy like liquid, like which is the soothing and constructive. After that, we start for the plain like a solid fruits or anything. So break off the fast. Whatever time you have done for the fasting, it may be for the 8 hours or till the 24 hours, you should consider to start breaking of the fast should be with the bland diet. It's not going. So 16 to 8 means 16 hours of fasting within 24 hours in a day. So this we consider for like skipping of the breakfast or skipping of dinner. So these are the common things what we are following for the intermediate fasting. And types like various to which varieties we used to do for the intermediate fasting is alternate day fasting, every other day fasting, and fasting or non-consecutive days per week, or modified fasting regimes, then warrior diet, or the variation of the modification of the diet, like mimicking of fasting. So these are the 7 ways to do daily intermediate fasting. So first one, simple fast is for 12 hours, and brunch fast is for 14 hours, And crescendo fast is for 16 to 2 days per week, 16 hours to 2 days per week. And cycle fast is 16 hours to 3 times weekly. And strong fast 16 to 18 hours daily, or warrior fast is 19 to 21 hours daily. And 1 day fast, full like 24 hours fast each week. So these are the effects of the fasting, intermittent fasting, like which effect mostly we consider like for reducing the body weight, like a fat burning. And regarding that, once the we consider the cholesterol is a risk, but of all the cardiovascular system, and few things which induced by the lifestyle, because of the lifestyle which induce some other disease condition like non-communicable diseases, so which can be prevent or delaying by doing the fasting after getting the benefits of this brain and heart fat cells like lipolysis things or muscle strengthen and liver function this thing fat metabolism will be more improvised after the fasting. So how it works is eat food when we are feeding time, so it increases the insulin. So it stores sugar in the liver and produce the fat in the liver. So if we are feeding more, most of will be inducing about the fatty liver or some other condition which will be leading for the fat deposition. And if we are in the no food, means fasting in that time, decreases the insulin and burn the what stored sugar or fat was there in the liver. So this is the thing when we consider about insulin stimulant in the fat formation in feeding time, what are the fat formation and which are in the fast time, and how fat forms or how it's the metabolized increase. So how fasting impacts the immune system. So autophagy, obviously we know, which is not like a cleansing process, so what we call. Then reduce the inflammation, improves the microbiomes, and regenerate the immune cells. Fasting the microbiome and inflammation. So intermittent fasting, how it affects to the gut. Mostly we speaks about the gut-brain axis, so interlink regarding that, and about the microbiota. And adipose tissue, how it works in that microbial durability for that, and T-registered cells increasing because of the immune things, and about the leptin, adiponectin, and about the ghrelin things like a satiety or the hungry center, it will be metabolizing for that. And how this intermittent fasting for that fat burning in what we consider about keto diet. Nowadays people speak so much of keto diet. It means high protein diet and high fat diet. So as a naturopath we don't prescribe for that, but it is linked with this fasting, how it intermittent fasting, how we can improve when we are putting the more protein diet in our fasting time, intermittent fasting time. So it will be increasing the lipolysis system. And calorie restriction, so when we are having an autophagy triggering the immune system for the cancer patients, and reducing cancer recurrent or mortality rates. So these are the evidence-based effect of intermittent fasting. And how it affects the cells and hormones like insulin, cellular repairs, or gene expression. Mostly when we consider about gene expression, mostly minerals and vitamins, when fasting is in for more longer period, it used to prone of deficiency of those minerals like micronutrients and macronutrients. So gene expression can be happen. One thing is adverse effect is there, but another part is what we consider, which is having more benefit, positive side effect for that. And how long and how often to fast for best result. So according to the body types, it may be or thin or lean person, which is having not much of the fat contains in the body. So target is to reduce the inflammation and chronic diseases. So how much duration they can fast is 3 to 5 days. but every 8 to 12 weeks. And for the normal person, what we call as the normal moderate according to the BMI, Indian BMI or Asian Pacific BMI. Reduce inflammation and chronic disease, that is the target. And 4 to 7 days fast can be done in every 6 to 8 weeks if a person is normal healthy person. And overweight, it may be to lose the weight or inflammation or any other to reduce the NCD complication. So 5 to or more than 10 days fasting can be done every month, but all this fasting should be done under supervision. It has to follow the protocol, what it has to be, and they have to know what effect can be happen in the time or healing crisis we call during the fasting. It may be headache or vomiting or maybe diarrhea, fever or abscess, anything which happen. It has to be well educated before that and supervision should be done. So, these are the evidence based like regarding the fasting. So what we talk about the improve for the mental clarity and concentration, like even for the cognitive functions, weight and body fat loss. What people used to think recently in scenario is to reduce the weight. So it may be for they're having the healthy or moderate. So first thing we consider is fasting when we are having more body weight. So for that also we can use, but it should be under control. Reduction of inflammation. Any condition of inflammation we target to reduce the inflammation or any interleukins intermediate for that, or to reduce the inflammation we can do fasting or lower blood insulin and sugar for that. And few things like if anybody wants to increase the body weight or to normalize their hormonal changes, metabolism, even we consider for the fasting as a first line therapy. And these are the 10 like evidence-based health benefits of intermittent fasting. First thing is for the changes the functional of cells and genes and hormones, and lose weight, what I have told before, and reduce the insulin resistance, what we face nowadays, like if anybody has the PCOD, even it induces the insulin resistance more. So much dimension it can be reducing by doing the intermittent fasting. And reduce the oxidative stress, which will be the main cause of any disease condition, inflammation in the body, and heart health, cardiovascular systems, and various cellular repair process, and prevent the cancer. Like we can't prevent the cancer, but still we can follow something regarding that and to delay the things. And good for the brain, for the cognitive function or memory or concentration. And for the Alzheimer patient or prevent the Alzheimer. Lifespan for helping for life longer means anti-aging things. Also we can use the fasting. And what are the safety and limitation of intermittent fasting? So under one review it has done for the blood pressure we can do intermittent fasting. Insulin sensitivity, to increase the insulin sensitivity we can do intermittent fasting and to reduce the inflammation, cellular response to stress, and reduce the risks of chronic disease conditions.
All of you and also dignitaries of the stage for giving me opportunity to speak. My topic is on Panchamahabhuta and autoimmunity. So actually compared to any system of medicine, our system is very unique. And many people doesn't know, and in fact we don't have valid books in naturopathy, but much of validity if you see from 1901 to 2022 Nobel Prize in Physiology and Medicine, it will be related to our subject. Out of 122-23 Nobel Prizes, 60 to 70 Nobel Prizes in physiology is strongly relating to our medicine. And I would like to talk a few things on our system. Especially, we should talk on tachyphylaxis, which is not there in our system. For example, any drug, a hypertension drug or insulin, when they become hypertension or diabetic, our body will be highly receptive to the drug, and it will work with a smaller dose initially. But over successive doses, receptors to transport particular drug will get diminished and the drug dosage will increase. And this one, Nobel Prize on receptors in 2003. In our system, we don't have, and instead our body, the transporting mechanisms, systems, the receptors, it will improve through various our modalities. And I could relate 75 Nobel studies in physiology to our system, how our system is very strong than comparing to other medicine. And actually I am deviating from the topic, but I want to talk. In conventional medicine, the allopathy, like any treatment they give, it has lot of, it is based on symptomatic treatment that everybody knows. For example, simple vitamin D deficiency and B12 we will take. There are about 100 symptoms it can manifest if vitamin D is low. B12, low B12 will cause 10 to 12 symptoms like megaloblastic anemia. B12 is required for methylation of DNA. B12 is required for nerve conduction and so on. So what doctors is looking here, he is treating only the symptom. And if we correct one molecule or one supplement there, the 100 symptoms or the 10 symptoms which we suffer with low B12 can go away, including the irritation in the nerves and pain in the nerves. If 10-12 parameters in our body is normal, that we can think that our body is disease free. Like if you take centenarians, people who live for more than 100 years, like Okinawa, Japan, Costa Rica, Central America, and New Zealand, and some other places in Australia, people, they started their career at the age of 17 and they retire at 60. Again, they started a new career at the age of 16 and they retired from that career at 90. They started a third career at the age of 90 and they got retired at the age of 120. And even there, nobody dies in these places less than 100 years. If you see their lifestyle, it is related to our system. Their food habits, their lifestyle, like mud treatments, water treatments, the Mediterranean diet, so on. So, if 12 parameters in our body, that if you see the blood values, people who live for more than 100 years, their vitamin D is above 70. Their WBC count is 4,000 to 6,000. People whose vitamin D is whose WBC count is above 6,500, they live, they progress their age very faster rate. WBC is responsible, as everyone knows, to fight against infection and also our cell repair. So there is some threat in the body that there is continuous replacement of the cells and also fighting against the bacteria. How much time I have? So WBC, who's 4,000 to 6,500, they live for extra 15 to 20 years. So now I'll come to the subject. So I'll skip all slides. I'll be talking only on autoimmunity and mud therapy. So earth treatments, if you see the effect of mud, the cold benefit of mud, it can manage pain, and this won Nobel Prize in 2021. There are the receptors, actually it is, TRPM transient receptors is helpful to manage our somatosensory system. The whole thermoregulatory mechanisms, like we are talking on hydrotherapy, mud therapy, got valid in 2021 Nobel studies in physiology and medicine. So there are a lot of beneficial effects. So again, on magnetotherapy, the macrophages produce polyamines to induce proliferation or proline to induce collagen production, which further promotes wound healing, tissue repair with the help of medium high frequency magnetic fields. So they again study on Hippocrates in magnetotherapy. It improves the iron content and formation, osteocalcin formation, reabsorption ability during osteoclast differentiation process. The mitochondrial concentration and ROS levels and OCS were decreased under high magnetic fields, static magnetic fields. So there is we are working on HPA axis, hypothalamo pituitary axis. We are almost, we are 12 hormones we are checking on every patient, which are not there in this slide. It's a very short notice. I could not mention those slides here. Like DHA, dihydroepiandrosterone, dihydroepiandrosterone sulfate, the cortisol, testosterone, estrogen. Our adrenal gland has mainly three hormones: mineralocorticoids, glucocorticoids, and sex steroids like testosterone and estrogen formed through androstenedione. So most of autoimmunity cases were having very low this adrenal secretions secreted by the adrenal gland, and these are put on steroids. They try to kill their immune system because immune system is acting, their own immune system is acting their body cells. So in conventional treatment, they try to kill immune system. After 5 years, 6 years, our body will be unable to fight against bacteria, virus, and the cell repair process. So if they get any cold, it will not be treated in single day. For us, it will be go within couple of days or a week days. But in autoimmune cases of 6 years, 7 years of immunosuppressive drugs, their capacity to fight against simple cold will go away. Even for 1 month or 6 months, it will not be treated. Then that time they say that we have antibiotics. After every antibiotic, again you see the tachyphylaxis, the receptors will come down and you develop each drug resistance, and after 10 years, 12 years, you develop resistance to all variety of antibiotics. At that stage, there will be organ involvement, and they say it is autoimmune disease and we cannot treat it, or it's only control. So in nature cure system, our success rate since past 1 year is it's above 95%. Initially our success rate was very low, 50 to 60%. Now our success rate is above 95% in all neurological, and there are 84 recognized autoimmune disorders internationally by rheumatology associations. And nature cure is one the best solution, and we are able to, I can say 100%, but some people whose immunity is very low at end stages, they are coming and their body will be unable to fight for themselves. So, but if patient is stable, we can recover 100%, but again, patient has to follow the same regime. It cannot be treated in single day, but the suffering time will come down and the comfort time will increase. Within 8 months to 1 year, we can completely treat all kinds of autoimmune disease. How much time I have now? Yeah. Just finish it up, wind it up, it's time. Just leave last slide. So these are the case. We have treated almost 1,000 cases of autoimmune disease, and you can see before and after treatments. It's only within 20 days changes. The CRP and IL-6, IL-3, IL-4, also we are checking. I did not make this slide, but I can. This is only 7 days change. She was suffering with that rash since past 6 to 7 months, but just 7 days of treatment, she has recovered from her butterfly rash. So due to continuous inflammation with our immune cells, there are various kinds of immune cells, cytokines, immunoglobulins, different proteins, interaction, this oxidative stress, it will take out extra electrons and extra oxygen from the healthy tissues, and there will be very progressive inflammation if we can arrest them. And we are giving around 500 different kinds of anti-inflammatory, the antioxidants in the form of flavonoids, in the form of phytonutrients from various ways. We think that we get energy from only food, but there are around 5,000 breatharians in the world. They're taking only air and water and sunlight, and we have forgotten to take energy through meditation, through breathing, through sunlight, and we think that we get energy only from the food. So many people may ask that what diet you give for lupus. No, there is much more than diet. The other treatments, naturopathy, modality treatments can work body very efficiently. And even the vitamin D, the sunlight will inhibit the proliferation of cytokines from the body. And also vitamin D is a steroid. It has three functions. It is a steroid, it is a hormone, and it's a vitamin function. So the necessity of corticosteroids and all kinds of immunosuppressants can come down with vitamin D, and the side effects are negligible or nil. So I conclude this session. So naturopathy is the future. We have interaction with many countries, and also recently we started with a project with NITM, National Institute of Traditional Medicine. So I thank you for giving this opportunity. Thank you.
Thank you so much, Dr. Karthik. Now I'd like to invite Dr. Jyoti to please call upon Dr. Sujata, our next speaker. Thank you.
Dr. Sujata KJ is currently working as the Vice Principal of SDM College of Naturopathy and Yogic Sciences, Karnataka, and she is the Dean of Division of Natural Therapeutics, Professor and HOD of the Department of Hydrotherapy. She is graduated from SDM College of Naturopathy and Yogic Sciences in 1995, and feel very proud to say that she is from the second batch of the esteemed College of Naturopathy and Yogic Sciences in 1995, and she has also done her MSc in Yoga from S. Vyasa in 2005 with 27 years of teaching experience and clinical experience. Dr. Sujata has participated and presented various papers at international naturopathy and yoga conferences. She has also conducted workshops on women's health. She is also recognized as PhD guide for candidates pursuing their doctoral degree in the Faculty of Yoga and Naturopathy under Rajiv Gandhi University of Health Sciences, Karnataka. She has published 43 successful research papers in national and international journals. And all the students whom she has taught will be very proud that we are her student. I am very blessed to say that I am one of her students too. And we welcome you, ma'am.
Namaste to all. My presentation is on hydratic applications in health and disease. So, whenever we say about hydratic application on health, usually we have to cover up the maintenance of health and promotion of health through hydrotherapy. And when we say about the disease, we need to talk about the treatment of the disease as well as prevention of the disease. So here, when I say about the definition of hydrotherapy, I would like to keep in this way. The hydrotherapy is the treatment through water in different temperatures for different durations and in different modes for promotion and maintenance of health as well as prevention and treatment of the disease. So whenever we say about the health promotion, according to WHO, it is a process of enabling the people to increase the control over all the processes, all the activities, as well as those habits which can improve their health. So, if you want to say about the determinants of health, especially when we say the promotion of health, we can just say the promotion of health has different influencing factors. It can be genetic, biological, environmental, social, or it can be related with the individual lifestyle. So, coming to the cardiovascular system, the applications of hydrotherapy can be hot applications which has passive heating effect, or exposure to cold temperature, or exposure to neutral temperature. The applications in passive heating can be like steam bath, sauna bath. Exposure to cold application can be cold water immersion bath, cold chest pack or hip bath or mud packs, and exposure to neutral temperature can be neutral packs and neutral immersion. So when we say about the passive heating, the first and foremost idea which comes to us is that the body is getting heated up with the sauna bath or steam bath. There will be increase in the core temperature, there will be increase in the cutaneous blood flow, there will be increase in the sweating, and there will be increased flow of blood to the muscle and limbs. So because of that, there will be decrease in the venous return, there will be decrease in the blood volume in the heart, then there will be decrease in the mean arterial pressure, where because of that there will be decreased blood volume in splanchnic organs or abdominal organs, resulting in increased splanchnic vascular resistance. The decreased venous return also has another effect, that is there will be compensatory increase in the stroke volume, resulting in increased cardiac output, which decreases the vascular resistance. We have the reference at the bottom of this slide. The second effect of passive heating is decreased carotid intima media thickness, which results in decreased aortic pulse wave velocity. There will be increase in the femoral dynamic arterial compliance also. The repeated exposure to heat can also lead to shear stress, which results in increased flow mediated dilatation, and there will be increased shear grade. The passive heating also increases heat stroke protein 90, which increases the nitric oxide production, so inflammation can be taken care. The heat stroke protein 90 also inhibits smooth muscle hyperplasia and hypertrophy, and it decreases endothelin 1, so which is a vasoconstrictor. So whenever we talk about the passive heating as such, if you take sauna bath for example, in gist we can just say that there will be decrease in the inflammation, there will be decrease in the blood pressure, decrease in the total cholesterol, then there will be improvement in the reaction of the immune system, there will be increased cardiorespiratory function, there will be increased arterial compliance. So coming to the evidences, we can just say that the Regular sauna bath can also help in health promotion. The title of the paper here is Cardiovascular and Other Health Benefits of Sauna Bathing. It's a review. It concludes that regular sauna bathing may improve cardiovascular function via improved endothelium dependent dilatation, reduced arterial stiffness, modulation of autonomic nervous system, and also beneficial changes can be seen in circulating lipid profiles, and there will be lowering of systemic blood pressure. So passive heating also results in increased left ventricular ejection fraction, and the heat stress shifts blood volume from thoracic and splanchnic regions to aid in heat dissipation, and simultaneously it increases heart rate and ejection fraction. Coming to the spinal bath, one of the single arm study, it shows that there will be short-term reduction in both systolic and diastolic blood pressure, pulse rate and temperature. A warm foot bath, it increases foot temperatures and distal proximal skin temperature. The distal proximal skin temperature gradient, it will result in enhanced coronary flow reserve, and there will be reduction in cardio-ankle vascular index. One more study related with the full wet sheet pack shows that there will be significant increase in the pulse rate, respiratory rate and peak flow rate. We also find that there is neovascularization which can happen by the cold water exposure, maybe in the form of cold immersion bath or cold local baths. If you talk about cold immersion bath, there is one more evidence which says that there will be reduction in the cardiac preload and afterload. The immersion in cold water, it will induce the thermogenesis, that is called as cold induced thermogenesis. It increases metabolic rate. So the same can be applied for the immersion bath, local immersion baths like cold hip bath also, or cold spinal bath also. So we say that the cold hip bath or spinal bath helps in decreasing the parasympathetic, there will be influence on the parasympathetic activation, and there will be dilatation of the vessels of lower abdomen. The thermic reaction which has been set in by the cold application, it increases the nutritive processes, and there will be contraction of the muscular structures of the viscera. So there is one more evidence about the cold water which says that there will be increase in the peripheral vasoconstriction, and here is one more evidence about the immersion bath with the title Human Physiological Responses to Immersion into Water of Different Temperatures. This study concludes that the plasma, noradrenaline and dopamine concentrations were increased, and plasma aldosterone concentrations were increased, and plasma renin activity was reduced. We have one more study where it says about the immune changes in humans during cold exposure. The conclusion is cold exposure significantly increased circulating T cells and B cells. Cold exposure increases the tissue level of immune reactive substance P. So that's about the health promotion, I can just say. Coming to the disease prevention. So prevention related to the actions aimed at eradicating, eliminating or minimizing the impact of disease and disability. According to Hippocrates, he emphasizes on two types of prevention, that is by ensuring healthy environment and by personal habits. So all these help in the popular phrase called as prevention is better than cure. Whenever we talk about hydrotherapy as a preventive measure, we can just say that the hydrotherapy helps in detoxification, it helps in loosening the tense muscles, it assists in relaxation, and it enhances the metabolic rate and digestion activity. It helps in hydration, and it also helps in improving skin resistance and muscular tone. And all these together, they help in efficient functioning of immune system. We had conducted one experiment about the cold plantar douche in constipation. The conclusion of the experiment is that when cold plantar douche was given along with the high fiber diet, it found beneficial in the management of constipation by reducing its severity and improving the gastric motility compared to only the high fiber diet group. Coming to the applied anatomy and applied physiology of cold abdominal pack, which is also given as a preventive measure in hydrotherapy. The cold abdominal pack increases the muscle tone of the abdominal muscles, and it balances between anabolic and catabolic mediators. It eases the inflammation by reducing the interleukins and tumor necrosis factor. Coming to cold percussion douche, it elevates the bowel dyssynergia of pelvic organs, and it also relieves the chronic intoxication by stimulating the vasomotor center. There is one more evidence which says that the anal sphincter can be relaxed by the hot baths. So all these can be used to prevent the accumulation of morbid matter. And here is one evidence about the piloid ballenotherapy. Piloid ballenotherapy reduced the clinical symptoms and raised the number of ulcer healings and normalized acid function of the stomach in the duodenal ulcer patients. About the intake of sulfur-tech chloride sodium mineral water, it activates the regulation of carbohydrate metabolism by insulin and cortisol due to the formation of adaptive reactions. Whenever we say about colon irrigation as a disease preventive hydrotherapy measure, colon irrigation induces lymphocyte transmigration, and it can also improve the colon and immune system function. The drinking of cold water was considered as a preventive of many of the diseases by removing the morbid matter from the body. And there is a study about drinking of cold water with the title Influence of Water Drinking in Resting Energy Expenditure in Overweight Children. It concludes that drinking of 10 ml of cold water per kg of body weight resulted in an elevation of REE, that is resting energy expenditure, up to 25% from baseline values in the overweight children. Coming to the applied anatomy, physiology and biochemistry of hot cis bath, the cis bath helps in relaxation of anal sphincter. It removes the rectal neck pressure, and there will be release of prostaglandins. Whenever we say about the hot compress, we can just say that the hot compress, especially to the abdomen, it increases the tone of the abdominal muscles and pelvic floor muscles. Then the bowel sounds increased by 1.7 times compared to the bowel sounds before the application. The hot compress also increases the secretion of motilin and gastrin, which helps in increasing the gastric motility. Another case report, it says that the hot foot and arm bath, it reduces the mucus accumulation and elevates the bronchospasm. The balanotherapy, which is being evidenced by a paper with the title Balanotherapy for Chronic Venous Insufficiency, concludes that the balanotherapy results in improvement of the pain, quality of life, and there were skin pigmentation changes too. Another research evidence about hydrogalvanic bath, where water treatment is given along with the small electrical current being passed. That's why it is called as hydrogalvanic bath. It says that there will be increase in the volume of polypeptides, endorphins accountable for pain relief, and there will be decrease in the increased sympathetic tone, especially in chronic non-specific neck pain. So like that we have more evidences here, and we have warm bath also. And coming to the disease, treatment of the disease through the hydrotherapy, we have papers related with the asthma, and we can just say that the water treatment, especially whenever it is given with less temperature, it decreases its spasticity, it increases its threshold for the pain, and it decreases the edema. And there is combined treatments in hydrotherapy like steam bath with cold chest pack, which relaxes the muscles and increases the cardiac output. And there will be, Epsom salt bath being mixed with the neutral immersion bath, and we can just have the beneficial effects by this also. All these are for prevention of the disease and also for curing of the various diseases here. The steam bath is also being associated with the cold shower, that also has beneficial effects, and we have beneficial effects by keeping a cold compress on the neck. And that's about my presentation today. We can just say that there is vascular and neural therapy, to say that hydrotherapy is helpful in both health promotion, maintenance of health, and disease prevention and treatment of the disease. Thank you.
Thank you so much, Dr. Sujata. A small announcement, we have parallel sessions going on in the Rajkumar Bhavan as well. So next I would like to call upon ma'am to invite our next speaker, Dr. Himanshu Sharma.
Dr. Himanshu Sharma is currently working as Principal and Head of the Department of Community Medicine at Sant Hridaram Medical College of Naturopathy and Yogic Sciences for Women, Bhopal, Madhya Pradesh. He has graduated from Rajiv Gandhi University of Health Sciences, Bangalore 2005, and after acquiring his master's degree in public health from London Metropolitan University in 2011, he has returned to India, where he has worked with diverse stakeholders of yoga and naturopathy. He is a panel examiner for various universities and has been the personal yoga physician for ex-Defense Minister George Fernandes. He has published 9 papers discussing clinical applications, policy and perspectives of yoga and naturopathy in index journals. His areas of interest included clinical naturopathy, non-communicable diseases and public health. And I welcome you, Dr. Himansh. Please. And I always, I just have to add one line, that he is a very, very active principal of the college, and I met him in his place. He is always working for the welfare of the students, and I congratulate you for that hard work, Dr. Himanshu.
Good morning, everyone, and thanks a lot, Dr. Jyoti, for such a warm welcome and praising a lot about me. But I'm here for my talk, that is role of yoga along with naturopathy in disease management. I hope this presentation will change that many things are going on, and why yoga people have been practicing in their field as just yoga practitioners or just naturopaths. It highlights what are the similarities and why it has to go together. It is something like multi-layered, holistic approach. So, and few basic concepts I will start with. So what is naturopathy? We all know that it is a system of man building in harmony with constructive principles, which Dr. Lindlar told in 1924, and he even told about like what is naturopathy and how it started off. So it was a complete basic science. It is actually, when they say that it evolved, medicine has evolved over the years. Actually, what I consider it as, it is a primary science, primary medical science from which all other therapies started off. Hippocrates, he was considered as father of medicine. He is considered as father of medicine, and he was observing upon his observations. He was considered as philosopher also, and actually those were the scientific observations. So I feel that it is the most primary system of medicine which has evolved, from which other systems of medicines has evolved. So it is, and there is again the treatment, the constructive principles and all. When we talk of diagnosis, we talk of in naturopathy diagnosis about the tongue diagnosis, nails, skin color, hair. So, and the treatment is again planned accordingly. In different other systems, there is individual system they check out, like cardiovascular system in conventional system of medicine, or in Ayurveda different streams or specializations are there, where again that diversification has happened, and because of that patient is facing not getting the holistic approach, rather than it is a systemic approach they are dealing with. So patient is harassed on that part. They will be moving from one department to other department, or have multiple consultations from different specialists, but at the end, none of them will be achieving to give the health care to the patient. So what I've written over here is ancient naturopaths considered it as a primary system of healthcare, which is more based on wisdom of healing and in different cultures. So even the cultural values have played an important role. So if I am an Indian doctor and treating an American patient, definitely it has an impact, and what practice I have as a naturopathy, the concepts go same, but I have to be aware about the cultural practice of the patient also. So earlier, people of different civilizations have used these naturopathic principles to live in harmony and to stay healthy actually. So the naturopathy is based on two main philosophies, which is vitality and holism. So, and we have known all, even studying that BNYS graduates, that vitality is so important, and in different systems they consider it as somewhere as chi, somewhere as prana. So in naturopathy, that is the main concept. And vitality, where we get it from? The food. So food shall be your medicine. So vitality is a central tenet in the philosophy of naturopathic medicine. It is invisible power which is noticeable only from its effects. So that is very important line. I can say that in the term of health, when the person defines that it is infirmity, we always say spiritual, mental, all the planes of being. But when we define health, at the end we say absence of infirmity. What is infirmity? Nobody usually focuses on that. Infirmity is something which we don't feel like, or we don't have that much energy that we are healthy enough. So that is infirmity. So vitality is that aspect we should correlate to. So vitality is the invisible power which actually stimulates the living organism as its ability to grow and develop, respond to stimuli, and reproduce and repair also. So sometimes we eat food, but in terms of what modern nutrition has come up with, carbohydrates, fats, proteins, we eat, but it does not or it does not contribute to the growth, or it does not contribute to the repair of the system. So vitality is that how good we eat, how more unprocessed natural food we eat. So it adds to that. Then second approach is holistic approach. So it is holism, which is actually it is just in medicine we say that it is holistic approach is one particular organ rather than we treat whole system of the or whole body. But as a public health specialist, I will say that holism is just not the body, it is the environment, it is the society, it is the culture, it is the whole environment or the interaction of a living being with the environment. That is holistic approach. So this approach is based on the understanding that all the entities and systems in the universe exist and as a unified whole, and the parts are dynamically interdependent. So we study homeostasis systems, they interact with each other, and that's how one system collapses, then other systems also collapse. So in the holistic approach, if we are not maintaining the environment we are living in, again it will have repercussions on our health. So that is the holistic approach I'm talking of. So what is health? Health is actually WHO defined just three dimensions: mental, physical and social well-being, and not merely the absence of disease or infirmity. So what is infirmity? I have told before also, it is a state of being weak or ill over a period of time. So you are feeling weak. Physically you may not have disease, or mentally you may not have disease, but psychologically you feel that you are too weak. So vitality is quite low. So that is the most important thing from where the seed of a disease start off. When we talk of in yoga, that is a mana-maya level, you can say, or you can say at emotional level, the disease originates, or the psych level, psychosomatic illness, psych level, the disease starts. So what I feel is that it's not the physical, mental or social, it is the infirmity. The person start feeling, and sometimes due to the obligations, being at work or being at contributing, or you can say they can't avoid the situations, they go under such stress, and because of such stress the impairment of the tissue occurs. So WHO defines only these three specific dimensions, and there are actually multiple dimensions, somewhere around 15, 16, or even you can say in Park book there is some of the dimensions I have mentioned over here, that vocational, cultural, philosophical and all. But it is individual specific also. It is the person, how many dimensions they are involving in, they have to be in balance. That is the dimensions of health. So at the end we can say that the health is not a constant thing. So we as a public health specialist, we can say that it is every person whosoever is living in the pre-pathogenesis phase of a disease. So disease is always occurring, but as an epidemiological triad, the agent factors, the host factors, and the period of time of exposure to a particular, you can say, disease or the agent, that fast the disease will occur in a person. So these it varies as these dimensions interact with one another, and it lies along the continuum of spectrum of health. Like the highest of that is the health is the highest point, that is positive health. The person is feeling happy, mentally also happy and positive about their health. And the lowest part of the spectrum is the death. So we have the people who are working, they are living, the disease, physically the disease, they might not be having any disease, but they are falling on that spectrum of the health. So they may be feeling weak, they may be feeling pain, but still continuing the thing. These dimensions, they have, along with that, they are having hereditary, behavioral factors, and the life stress, which has a huge impact on the neuroendocrine functions actually. So we know that some of these stressors, they increase the cholesterol level and they increase the biomarkers, and it has an important role on the behavior. And it is the individual's own responsibility. That's the behavioral factor. The behavioral medicine comes in. The lifestyle medicine nowadays it is called as. So there, actually the thing, it's the person's behavior. They have to follow a healthy lifestyle. They have to be committed towards their own health. So you can't eat a junk food and you can expect a healthy environment or healthy body for yourself. Or you can't cut trees and then you can't have a healthy, it will not create an impact on your environment, or you can say on your lungs or microbiome. So what I want to say is hereditary factors, behavioral factors, and life stress also has a huge impact on the health of a person. So what naturopathy is disease management, the therapeutic order, it is address the acute concerns. Usually what we have when the patient comes to us, we usually go for just this therapy you can take. So you need to take a detailed case history on that, address the acute concerns, re-establish the basis for health, that is by including the healthy regimen and removing the toxins. So there's one of the principle that dossier, the teacher is actually a naturopathic doctor is a teacher. So dossier means teacher who teaches. So we as a doctor, we teach them healthy habits so that they inculcate. So re-establish the basis for health, then stimulate the healing power of nature, like living more natural ways, natural environment, more of eating of organic food, then tonified the weak system. So usually the new naturopaths or the new doctors, they immediately go for the prescription of the treatment. So we are actually skipping the first three parts and rather going directly on prescribing this hydrotherapy treatment or this physiotherapy treatment or this mud therapy treatment. We don't go for the counseling, or we don't address their acute concerns, as well as we don't go for the establishment of the basis, because from there the vitality is coming. These just our naturopathic modalities are actually just the stimulators for the improving the vitality. They are actually causing the detoxification to improve the prana flow. Okay, so prescribe the specific natural substances like what I told, food shall be your medicine. So if you can give that also. Use higher force, that is the last resort. If you can't avoid anything, then only you can go for surgery. I would not say that you should not, but that is the last resort. If you can't help out anywhere and things are not happening, then the surgery or suppressive drugs can be given, or you can say chemotherapy or any other things can be given. So yoga means huge, and it again we say that it joins. What as a person say that it joins. Yes, it joins with whom? It joins with God. Yes, it joins with anybody. Individuals, environment, with God, all the levels. And again, it joins at all the levels of existence. So that is yoga. So yoga has beliefs in bodily existence based on Panch Mahabhuta as naturopathy, like earth, air, water, ether, and fire. Trigunas, sattva, rajas, and because of the behavioral, like the tendencies the person develops, you can say the behavior, the personality develops according to that. That is the interaction. Then Panch Koshas, that is the 5 levels of existence. That is again Annamaya, what we eat. Pranamaya, again the vitality coming from the food. Manomaya, what we eat, that's our mind thinking processes. Jnanmaya, okay, things are going, how much we have studied, that is Jnanmaya Kosh. And Anandmaya, after all the things we did in our life, are we happy with that? That is Anandmaya Kosha. So a balance at all these levels. Sometimes we say that a person does the thing but still they are not happy. We are earning a lot but still not happy. So Anandmaya Kosha. After all the levels of existence, the 5th level is at peace or not? That is the most important thing. So how the disease starts, the concept of disease in yoga is something different, which is ajirnatva, what we eat, how much more we eat, under digestion, over digestion, and wrong digestion. That is ajirnatva, atijirnatva, and kujirnatva. But Patanjali has told that this is not the only thing, the food. It is again the chitta vikshepsas, which plays a very important role. That is our mind. So chitta vikshepas, again, along with that, kleshas are there. Then antarayas are there. We all know about Patanjali Yoga Sutra, so I'm not talking deep on that. But yes, we know, but still, as a teacher, as a doctor, naturopath doctor, we need to tell the patient, we have to identify and we have to teach about that also. So symptoms of disease, as mentioned by Patanjali Yoga Sutra, is dukkha dormanasya angamejatva shwasa prashwasa. Okay, so mental and physical. So again, what we have discussed in 5 koshas level, this is the thing happening. So why yoga and naturopathy? How yoga helps in? We have studied this very much beautiful quote, that 2 wheels of a cart. And yes, it is a 2 wheels of cart which has same concept, same ideology, same philosophies, and it is very vast thing. So why both and yoga and naturopathy should be together, should be practiced together? It believes in philosophy of holism and vitality. That is the first and foremost thing. None of the other systems. So yoga and naturopathy should be together, should be practiced together just because of this reason. Then emphasize on the qualitative aspect of health. None of the system, they say that the quality of life, if you can't stop a disease, other systems, they don't improve the quality of life. We talk about health promotion, positive health, and improving the quality of life. Okay, so, and both the systems, yoga and naturopathy, considers health as a multi-dimension, and it treats the whole body, and that is why it emphasizes in promoting the activities of healthy living. So that's the main reason that yoga and naturopathy should be practiced, and this is why that is the main role. We know about the physiological aspect, how yoga improves endocrine functions, cognition and all, balancing the mind spheres. That is, but usually as a practitioner, you should practice this together. Thank you very much. So in that, there are a few things I would just like to just mention it. Some of my following and previous presenters, speakers, they have already discussed. So Ahar, Vichar, yoga is talking about that also. Even as a naturopath, we are talking on that. So what we can do is Maitri Karuna and psychoneuromuscular endocrine system stress we can reduce, we can recondition with yoga. So naturopathy works on detoxification, yoga works on the mental level and endocrine functions, and this is the thing, how it contributes. So in conclusion, naturopathic modalities and yogic practices have been found effective in producing physical and mental relaxation and influencing almost all the systems in our body and improving the quality of life. I would like to say that there is a lacuna over here that most of the studies, these are some of my references, the lacuna is most of the studies, they are performed on individual aspect. When we try to consider, or you can say we are framing naturopathy on the evidence base, yes, but we are just doing that, but when we practice, it should be holistically practiced. We should not be, again, as a conventional medicine, we should not be separating it, our system like that. Okay, that's all. Thank you very much.
Thank you so much, Dr. Himanshu. We have a last speaker for the Pancha Mahabhuta session. Would like to invite ma'am to invite Dr. Venugopal V for the next presentation. Thank you.
Dr. V. Venugopal. He is the Assistant Medical Officer cum Lecturer at Government Yoga and Naturopathy Medical College and Hospital, Chennai. He has graduated his BNYS from Government Yoga and Naturopathy Medical College, Chennai. From Medical College Chennai, and he has completed his Masters in Diabetes from UK, and he also owns a PhD in Yoga from S. Vyasa University. He is a renowned diabetes researcher and scientist with over 50 scientific research publications in index journals. Dr. Venugopal served in many prestigious institutions in various roles as a scientist, research fellow, and contributed to various government-funded research projects funded by Ministry of Ayush, ICMR, etc. And he is also a professional member of Diabetes UK, British Registry of Complementary Practitioners, and Research Society for Study of Diabetes in India. And I would like to add one more note. He has lovely and very, very interesting, informative videos on YouTube. So you can just hit the link on YouTube and find more and more information, minute. I would always say the minute, whenever I used to forward his YouTubes to my patients, they would always say that the smallest, the minute details are very important in the treatment, and he's doing a great work in this field. So I welcome you, Dr. Venugopal. You're an amazing person. We love to hear from you.
Thank you so much for the kind introduction, ma'am. Dignitaries on and off the dais, my dear respectful mentors, teachers, and my dear students. Very good morning. Today I'm going to present about Is it on? Okay, so very good morning, and my topic today is managing metabolism through naturopathy on based on Agni Sigiksha. So what we're going to see is what is metabolism and metabolic disorders, what is the commonality in the metabolic disorders, and how to manage it, and the conclusion. To begin with, metabolism, as we all know, has two processes. One is catabolism and anabolism. Catabolism is breaking down of complex molecules, say protein into amino acids. As a result of it, energy gets released. And as far as anabolism is concerned, the smaller molecules get together to form a larger molecule, and that needs energy. The commonality between both is the energy or fire, the Agni part, what we are going to talk about today. And metabolic disorder, more than metabolism, if any of the processing, either be the anabolism or catabolism, gets disturbed, that leads to a variety of metabolic disorders. So what is the pathway? What is the commonality between all these things is it works via oxidative stress and inflammation. So oxidative stress is kind of a spark plug, you can say, which ends up in fire of inflammation. So this actually acts as a center theme, inflammation part, for most of the non-communicable disorders, not just non-communicable disorders, even for communicable disorders. COVID time, as we all know, like before COVID, it was very difficult to explain people what exactly inflammation is, the chronic inflammation or the acute inflammation part. But people started to know about cytokine storm. Cytokine storm was like the magic word at that point of COVID and was very much easier. So even for communicable disorders, inflammation plays a key role. So coming to the management, first we'll be fighting fire with fire. So we're going to talk about, instead of physical activity part, we're going to talk about yoga, sun bath, chromotherapy, and thermogenesis. To begin with, yoga, I'm just going to talk very little about yoga here. So we have many systematic reviews and meta-analysis which says yoga is beneficial for diabetes. Likewise, through the activation of the pathways, inflammatory biomarkers seem to be reduced well with yoga as well. And this is our study run at Government College, Chennai. Effect of yoga on oxidative stress, a meta-analysis again which showed yoga to be beneficial. To kind of summarize the mechanisms, and I wanted to talk about the mechanisms mostly because as naturopaths, that is what we are more interested in. As naturopathy students, we would like to know the mechanism. So how yoga is beneficial in the management of diabetes. It's not just about insulin release or the, insulin resistance alone. That's not just diabetes. There are other pathological abnormalities or the pathophysiological abnormalities which happens, what we call as ominous octet model, the 8 pathophysiological abnormalities. And yoga has got the potential benefit in being beneficial in all of these 8 parameters. To kind of, this is a summary overview of it. Yoga, through the improving in vagal tone or reduction in glucagon, oxidative stress, GABA, and inflammation, would probably be beneficial in reducing hepatic glucose output, acute phase insulin release, so on and so forth. Right, and yoga is also found to be beneficial in very many cardiovascular complications. And due to paucity of time, I'm going to talk only about diabetes and cardiovascular abnormalities and not about other conditions here. Right, now coming to sun exposure. There are contradicting evidence on the benefits of sun exposure as far as diabetes is concerned, and this study done in Korea, what it shows is people who are exposed to sunlight 5 hours or more are more prone to get diabetes. And while there are other things which shows like sun exposure is more beneficial, so what they showed is sun exposure lowers the risk of diabetes by 30%. So there were contradicting evidences from the studies, but a systematic review clearly shows sun exposure has got beneficial effects in reducing the risk of diabetes. Right. Now, sun exposure, what we see is like in your adipose tissue, UVB rays hits your adipose tissue, and it gets metabolized in liver and kidney. We get active vitamin D3. So it's not only about that, because studies done in Japan which shows like irrespective of sun exposure, if people get like more of vitamin D rich foods like fish, those diets are found to be beneficial in improving their vitamin D levels. It need not necessarily be like they have to be exposed to sun. And studies again show the same. Sun exposure and vitamin D are not the same, because God or nature did not create sun just for giving vitamin D, right? So there are other benefits. There are other pathways through which sun exposure is probably beneficial in metabolic disorders. There are 3 pathways mentioned in this specific slide through the heme oxygenase pathway. So what it does is it breaks down heme into carbon monoxide, Fe, and biliverdin. Carbon monoxide, as we all know, it helps in reducing inflammation. Likewise, biliverdin is a strong antioxidant. It activates PPAR gamma pathway as well. Similar to the glitazone medicines, what they generally give for diabetes patients. So it helps in reducing blood glucose level, cholesterol, and body weight as well. And likewise, it activates nitric oxide. Nitric oxide, again, it's a potent vasodilator. For many conditions, either it be hypertension, cardiovascular disease, or diabetes, there is nitric oxide deficiency, and sun exposure is found to improve nitric oxide secretion as well. And the other thing is improving the POMC neurons, pre-opio melanocortin neurons, which we all know it is good for circadian rhythm. It's good in regulating circadian rhythm. It also helps in reducing food intake. And that is what all the papers say as well. And one more important thing is COVID as well. So even during the times of COVID, sun exposure got direct influence on the outcomes of COVID. And we all know, like being a very densely populated country, many of the Indians got infected with COVID. But the thing is, the mortality rate was much lesser. So what studies show us, the death or the mortality due to COVID increases with latitude. So it is not about the temperature or any of the other factors. It's mostly because of their exposure to sunlight as such. So talking about COVID and sun exposure, and yesterday as Karthikeyan sir was mentioning about these studies done in Tamil Nadu on COVID patients and other things. So happy to say that we have like nearly 10 to 12 publications getting published on various aspects of how yoga and naturopathy works on COVID, post-COVID syndrome, and even for Omicron as well. So the last of which is a qualitative study getting published in high impact journal, impact factor of 13.89. Okay, next is chromotherapy. Chromotherapy, how scientifically it works. We know blue color relaxes us and we know red color stimulates us. How this is happening is, talking about the high school physics, when electric current passes through a solution, it splits the solution and few of the particle moves towards cathode and anode. We have read that in high school physics as well. Consider light as electromagnetic, consider colors as electromagnetic waves with certain amount of wavelength and frequency. So when that specific color, that is when that specific electromagnetic wave passes through a solution, it brings about change in it. So what this particular study found is, they pass like different colors through specific solution. One was the glucose oxidase, the other was cholesterol oxidase, esters and lipase. What they found is, purple color showed to activate glucose oxidase. In other words, clinically, purple color helps in reducing glucose levels, and likewise violet is beneficial in dyslipidemia conditions. And the next study is on superoxide dismutase. Again, through this enzyme they passed various lights, and what they found was red color and orange color. I mean, red color mostly was found to be beneficial in activating superoxide dismutase, which is an antioxidant. Right, and these are the various other colors and how much it stimulated as such. So yellow was the least stimulating, black was even worse, but red color was found to have the antioxidant property. We're talking about photobiomodulation. It is not about like exposure directly to head or anything of that sort. Thermogenesis. So thermogenesis can be done in 2 ways. One is through our food, what we call as thermogenic foods as such, with either be the capsaicin, peppers, or menthol, green tea, and all these things has got thermogenic effects. What it does is, it stimulates white adipose tissue to brown adipose tissue formation, and again cold exposure is one more thing. So what cold exposure does is it improves white to brown adipose tissue formation, and thermogenic foods does the same as well. And intermittent fasting is one more thing. So intermittent fasting has got an other pathway through which it activates thermogenesis through the vascular endothelial growth factor. And these are few of the genes which gets expressed when during the time of intermittent fasting. And yeah, in this specific picture, what you can see is from white adipose tissue, it turned down into beige. It's not like, it need not necessarily turn to all the way dark brown or something of that sort. It's like beige color, it has changed. And that increases the number of mitochondria at that specific cells. So that would help in increasing the metabolism. And likewise, you can see many new capillaries have been formed as well. So the nitric oxide secretion gets increased, and vascular endothelial growth factor as well. And one more thing is through the gut microbiota. Gut microbiota increases with intermittent fasting as well. So these are few of the thermogenesis independent factor through intermittent fasting. Through the expression of glucose transporter 4 as well, it probably helps. And fighting fire with water, we are coming into hydrotherapy. Hydrotherapy will start with cardiovascular parameters. So steam bath, we have like so many doubts in our mind, like whether we can give steam bath to cardiovascular patients, whether it is safe, whether it is not safe. To begin with, we wanted to do it on normal healthy individuals. Again, this is from Government College, Chennai. What we found is the systolic blood pressure, which has got something to do with the vascular resistance as such. So that initially increased. After that, it started to decrease. So the initial increase was 8.9, but like say after 10 minutes, it reduced from the baseline 5 mmHg, and after 30 minutes, it was even lesser. The diastolic reduction in diastolic BP, that was quite consistent. And there are very many meta-analyses done showing sauna bath, the dry form of heat therapy, to be beneficial in improving the cardiovascular function. It helps in improving the ejection fraction, as Sujata ma'am just now said. It helps in increasing ejection fraction, reduces blood pressure, it improves like brain natriuretic peptide concentration, and so on. And it also reduces the mortality. Cardiovascular and all-cause mortality gets reduced. And talking about like how long it has to be given. So how long it has to be given? So talking about the safety and efficacy of it, sunbathing is found to be, even if you are giving every day for 4 weeks, it is found to be beneficial. It is found to be safer. Right, and coming to diabetes, heat shock proteins and heat therapy, it does two things. It improves the heat shock protein 70, which is beneficial for protein folding. If there is any abnormality or there is any dysfunction of it, it leads to endoplasmic reticular cell, ER stress, and death of the cell. And likewise, HSP2 heat shock protein 72 as well is found to be increased, which reduces apoptosis. Tub bath, what we call as full immersion bath, that was found to be beneficial as well in cardiovascular abnormalities. And what to give, whether sauna bath or hot tub bath, both are equally beneficial. It has to be given. And the duration is important as well. Duration, they say it has to be like somewhere between 15 to 20 minutes. And these are few of the pathways through which heat exposure is beneficial, either to the nitric oxide pathway or HSP70 pathway. And we have to respect the contraindications. That's what this specific paper suggests. Now, what are the contraindications? There are papers which show like the vascular reactivity, the circulatory response. We talk about action and reaction phase in hydrotherapy. It's not what happens when you're sitting inside the tub. What happens outside the tub matters the most. I mean, of course, the safety part is very, very important. So the vascular reactivity has actually diminished up to 50% in diabetes patients. So whenever you are giving any treatment which is looking or aiming at reaction phase, please do ensure that there is mechanical stimulation. If it is hip bath, it has to be like you do it with friction, and if there is any cold foot bath you are giving for peripheral neuropathy, please do ensure that you rub their feet, because through the mechanical effect you have to bring back the solution, the circulation. And GH pack. So when it comes to diabetes, the common management of in hydrotherapy, what we say is GH pack, cold hip bath. But unfortunately, I couldn't find many papers. There were only 2 papers. And what we did is, it is not like pre-post thing. So there's this ambulatory glucose profile. So ambulatory CGM patch they used to wear. CGM patches measures blood glucose level every 15 minutes. So we got a baseline blood test done. So during when they were sitting in the hip bath or being in the GH pack, what was the blood glucose levels immediately after, 15 minutes after, and 30 minutes after. So what we found was the most significant difference came after 15 minutes and after 30 minutes, rather than when they were in the taking the GH pack or the cold packs. Right, and the pathways are through the cold-induced thermogenesis and transient receptor potential, which increases the TRMP activation, which improves the brown adipose tissue, through parasympathetic activation and insulin sensitivity. There are studies which show like cold exposure improves insulin sensitivity by 43%. This again, you can see the from 165 it showed gradual reduction, and the best reduction was found, the p-values, at 15 minutes and 30 minutes. Because the thermogenesis and the other process takes time, so it's not what happens inside, but what happens outside. Now, this got published in high impact, again, like 4+4 or 4.5+ impactful journal as such. But this was the only study which had a control group done in diabetes patient on cold hip bath. Likewise, in GH pack as well, we don't have many studies. Like talking about, like I was there in SGM college couple of months back. It was really nice to see like every PG and every intern who talks, every phrase they say with citation, they say with references. Likewise in Alvas college as well, they talk with scientific evidences. And last couple of months back again there was a conference. The first year students, there is spark everywhere. Like first year students of Sona college, they were presenting papers over there. And G10 college, like yesterday there was a G10 college student, when the cyclists were felicitated here, he told like next year we should also go and get it. So there is fire everywhere in every student, but the thing is the fire is like in different places. The spark is in different places, and collaboration, the collaborative research and the collaboration and co-creation would be really, really beneficial. And we have resources, either it be the MSR Institute. Only a couple of days back I came to know like there's such 700 bedded huge hospital, MSR Institute, and we have like again SGM college, SVSM, and I don't know like how many of the naturopathy community knows. The faculty members of Government College Chennai together have got 250 plus publications. So this collaborating between institutions would go a long way in bringing about the scientific evidences as far as naturopathy is concerned. I'm happy to have our international speakers as well to take it towards. So let there be light. Thank you so much.
Thank you so much, Dr. Venugopal. Before we felicitate our speakers with a token of appreciation, I would like to call upon Dr. Babina to please summarize.
Good afternoon to all. So as you all know that naturopathy is an art and science of healthy living and a drugless system of healing which does not imply any kind of medicine. So the fundamental difference between naturopathy and other system of medicine is that its theory and practice is based on holistic wellness instead of giving treatments to each organ separately. In naturopathy, we emphasize on detoxification because accumulation of toxins is the root cause for all diseases, and this can be completely eliminated, as our speakers have widely discussed about the role of Panchmahabhutas in detoxifying and rejuvenating our system. See, our body has got 4 natural outlets, that is colon, lungs, kidneys and skin. So we cleanse the colon in naturopathy with enema, colon hydrotherapy, hip bath, mud pack and various hydrotherapy treatments. And kidneys with the kidney pack, immersion bath and natural diuretics like tender coconut water, barley water, dhania jeera decoction, and the lungs with chest pack, asthma bath, drainage therapy, yogasanas, yogic kriyas and pranayams. And skin with the massages, steam baths, sauna bath, mud bath. This improves the blood circulation, lymphatic and venous drainage. Sarva rogaha malavashaha langanam paramaushadam. So that also was explained by our speaker very well, that abstinence from food is a supreme cure for all diseases. And yoga and naturopathy are like the 2 wheels of the cart. Naturopathy helps you to prevent the diseases and yoga helps to maintain it. And the last speaker, he spoke about the effect of diabetes on naturopathy treatments. So thank you very much for all the speakers.
Thank you so much, ma'am. Now we have Dr. Surya Bahadur, who would give the vote of thanks for the session 5.
Good afternoon, everybody, and namaste. Thank yous to Ministry of Ayush, Government of India, Director CCRYN, Dr. Raghavendra Rao, Director NIN, Dr. Satyalakshmi, for organizing and inviting me for this conference. Kindly give clapping for them. Okay. Now, chairperson on this session, Dr. Babina NM, Dr. Abhaya, and Dr. Nagjyoti. Thank you for your chairing the session. Kindly give them clapping again. All 5 speakers spoke very well about the use of the Panchamahabhut in the naturopathy and the yoga. Thank you very much to all of them. Dr. M. Ramajyoti spoke about fasting. Dr. Kartik Reddy spoke about Panchamahabhut Tattva and treating various diseases. And Dr. Sudata Dinesh spoke about hydrotherapy. Dr. Hemansu Sharma spoke about the role of naturopathy and yoga in disease management. And Dr. Venugopal spoke about management of metabolism. All of them gave valuable and update information about the topics, which will be very useful for the student and practitioner. I wish to them all the best. Kindly give clapping them. And I would like to give thanks Dr. John, he came from Australia, and Dr. China, she came from Spain. And she also both World Naturopathy Federation founder and now also working them. And all the attending and participating all the, I would like to give the thanks you, and next year in 2023 we would like to organize a second naturopathic national conference in Nepal in October 2, which day in Nepal first started the naturopathic hospital, like Dr. Sona Parba, Dr. Birendra Prasad Burma. He was the first doctor in Nepal starting the naturopathic. Thank you. And last, I wish to all the very happy 5th Naturopathy Day, and I would like to again we see in Nepal in 2023. Okay, thank you very much.
Thank you so much. It's time we felicitate all the speakers. Firstly, I'd like to call upon Dr. Babina Nandakumar to felicitate Dr. Sujata Dinesh. Would request Dr. Sujata Dinesh to please come upon the dais. Dr. Karthik Reddy. Request you, sir, to please felicitate Dr. Karthik Reddy. Next, would request Dr. Himanshu Sharma and Dr. Venu Gopal to please come on to the stage. Dr. Venu Gopal. We request Dr. Ghanapriya to please come on to the dais for the felicitation. Thank you so much. Would request Dr. Vijay Lakshmi to please come onto the stage. Request Dr. Vijay Lakshmi to please felicitate Dr. Surya Bahadur, Dr. Nagajyoti, Dr. Abhay and Dr. Babina. Would request next Dr. Surya Bahadur to please come for the felicitation. Dr. Abhay. And Dr. Jyoti, please. Thank you to all the speakers and chairperson for receiving the token of appreciation. Thank you, ma'am. Would request all the dignitaries to please get off stage. Please note we have parallel sessions going on in the Rajkumar Bhavan. Thank you so much. We have one last panel discussion to end the morning's conference program before lunch. Would like to invite Dr. Naveen K. Vishwaraya, Dr. Ambedkar, Dr. Rajesh Padikal and Dr. Prashant Sethi onto the dais. A huge round of applause for all of them. Thank you so much. We have amongst us Dr. Prashant Shetty. He is the We have Dr. Prashant Sethi, the Professor and Head Department of Diet and Nutrition, SDM College of Naturopathy and Yogic Sciences, Ujjeri, Karnataka, India for the past 26 years. He is the Chairman at the Internship Committee, External Examiner at the MGR Medical University, Chennai, Internal Examiner and Squad Chief at the Rajiv Gandhi University of Health Sciences, Bengaluru, Member Postgraduate Syllabus Committee, Rajiv Gandhi University of Health Sciences, Bengaluru. He is also appointed as the Advisory Board Member for Naturopathy and Yoga, Government of Karnataka. He has done and undertaken a lot of research projects, one of them being the effect of yoga and naturopathy in diabetes mellitus, effect of an integrated yoga module on pulmonary functions in polystyrenes. It is an honor to have you here, sir. We have Dr. Ambedkar Vinayak Subhash amongst us. He is the Administrative Medical Officer at various government institutions, Registrar of the KUOP Board Karnataka, Medical Officer of Government Yoga and Naturopathy Hospital, LH Bangalore presently. Honor to have you here, sir. We have Dr. Rajesh Parikal amongst us. He is currently working as the principal of Shraddha Yoga and Naturopathy Medical College, Talapadi, Mangalore. He graduated from the first batch of SDM College of Naturopathy and Yogic Sciences with experience of more than 23 years in teaching and 28 years in clinicals. He has also worked as the Chief Consultant Nature Cure and Yoga for 18 years at Pranava Yoga and Naturopathy Center, Mangalore. He is an active member of Board of Studies BNYS, Rajiv Gandhi University of Health Sciences. Honor to have you here, sir. With us, next, we have Dr. Naveen K. Vishwaraya. He is an International Research Leader Fellow, Australian Research Council for Contemporary and Integrative Medicine. He is a visiting professor at the University of Technology, Sydney, Australia, Transdisciplinary University, Bengaluru. It is a great honor to have you here, sir, as well. Would request Dr. Naveen to please come and invite all the panelists onto the stage.
Very good afternoon. While we have been having series of keynotes and invited talks, the panels are very important to discuss, deliberate, and leave some questions in everybody's minds to go back to our respective setting, regardless of it being an education institution, a hospital, or a research center. And to do that, one inherent fundamental platform that we need to nurture is education. For all the consequential pros and cons that we experience in our clinical practice and regulation, we can always trace back either the advantages or disadvantages to our education. So therefore, education, professional education is something that inherently built to be progressively nurtured. And if we stop nurturing education, we'll stop growing. It's easy to mentor a doctor while they're students with us for 5 years. It's impossible to nurture somebody relatively once they're out. Of course, there are many means, avenues to reach out to the practicing physicians and give them real-time advances and progress that happens in the field. But that's a very optional, less impact activity as opposed to nurturing education. So here we are with very distinguished panel who can give us insights by virtue of their very distinguished career and contribution. Moderating education in 45 minutes as opposed to 1.5 hours that we were otherwise allotted gives us a good impetus to be a little more crisper and concise and dwell more on what we can do or what we need to do as opposed to recalling what we've done so far. So I request all the panelists to stay focused on possible solutions for the challenges that we face. To put things in perspective, I would like to pick up 2 or 3 core areas that we need to focus on today. One, by virtue of not having a central regulatory body, across the country, across 16 states, our professional colleges are spread, and therefore, education being a state chapter, there is flexibility in framing curriculum, and that is exercised by every university to their best of wisdom and knowledge. Something that we have to live with and accommodate. But nevertheless, we as a professional body and community, it is important for us to be on a common platform and a page so that 90% of this curriculum is by default voluntarily kept standard. So that while we are working on a central regulation, we are naturally there with a very standardized uniform syllabus. So there are very, very insightful things that a lot of universities have adopted. But then that has to be done in a framework that it can be practiced across the country. So we will have our panelists talk about these requirement of standardized curriculum that we need to have, at the same time to give a very fair small room for creative advancements. The second thing that we have to focus on today is evidence-based education. This is something that I have been interested in last 10 years. The first 15 years of my career, I was very, very passionate about evidence-based practice, so that we are very progressively engaged in evidence generation to what we know that works, and we adopt that evidence in our clinical practice. But what becomes more important to ensure evidence-based practice is to ensure evidence-based teaching happens in our college, so that our students in those 5 years are so much abreast with the real-time evidence that is available. And that works in many, many ways to their good. One, it gives an idea that we are, although a cultural system of medicine, but we are firmly rooted on evidence. Two, medical compatibility of any traditional medicine across the world depends on the quantum of evidence that is generated and adopted. Now, this can only be ensured if we have evidence-based education. So, I would like to hear the advancements that each of these institutions or the panelists can bring about, things that is already going on in the country, which we otherwise can adopt in every college. Lastly, we are now, unlike last 25 years, yoga and naturopathy as a lifestyle intervention is most sought after compared to any other Ayush systems. I think we should never be on our back foot to feel this. If you talk of integration, which is the theme of this conference, the most apt, suitable, and ready to be integrated amongst all the traditional systems in the world is yoga and naturopathy. One, it is drugless, so that there are less complexities involved when you want to integrate this with conventional medicine. Two, we have an education platform which brings in the conventional basic medical sciences with that of traditional therapeutics. Three, the disease demography that decides the course of any system of medicine favors yoga and naturopathy, as 74% of mortality is from psychosomatics or mind-body diseases. So therefore, yoga and naturopathy as a best form of lifestyle intervention lends itself for best integration. So where does it leave to us as educationists in the education institution? Time has come that we have to start thinking to be industry-friendly curriculum. For example, there is an organic farming and food revolution. There has been a holistic wellness and health revolution. And now in medical parlance, there is an integrative medicine revolution. How can we be party to these revolutions unless we are not in real time training our students to and exposed to these revolutions? Otherwise, we are always 10-15 years behind. So these are the three core areas that we can touch upon today. And I leave it to the freedom and the wisdom of each panelist to give their opening remarks on any one or more of these core areas that we want to focus on in 2 minutes. And then we will do a number of rounds discussing these three major factors, including taking some important questions if there are any from learned faculty who are with us today, and students, of course. So over to Prashant to give opening comments for 2 minutes.
As Dr. Naveen said, today it's a great challenge to the education institution. Why it is great challenge, you all know. See, education institutions which are working in the country, if they think only about the students' admission, definitely it will be a very challengeable condition to all the education institutions. I am saying, with my 28 years of experience and 15 years of experience as a principal and a clinician for 28 years and a researcher for last 10 years, I have come to know this fact. Without improving all the levels, like education part, research part and this clinical practice part, we cannot flow with the population because there is a big challenge to all the colleges now. Because how many years we can tell the story like this? So people are asking us. So this is the right time to solve this problem at all the three levels. And I am telling you, any education institution at this level, they are not able to solve all the problems. Because years of experience, teachers, faculty members and departments are required. So that also, it is a challengeable condition to all the colleges too. So simply opening the college, it will not fetch anything because it will not give any benefit to the doctors or the students. So my opinion is, by changing trends in the clinical practice, changing trends in the like education, we have to change. So I think our old notes are not applicable now because we have to go for the new notes. It's the right time. Otherwise, we will be discarded. So Dr. Naveen used to come and tell in our college. Now rehearsal course is required for the teachers also, he said. Because it's right also. We have to take it in positive spirit and we have to give the rehearsal courses or some better higher education practices to our people. So then also it may be very useful. At the same time, you may have to include some of the teaching aids also. Blackboard, chalk is there, it's the best education part. But I am saying, we have to go with the modern methods. And third thing is, training the students. Usually train the students with similar methods. Hostel we need to stay and all the classes will be there, 1 day holiday, that has to be changed. Because you have to have a regular touch with the students. Students in other systems also it has changed. You know, nursing education was there before. Now it is giving lot of changes. And medical education, how nicely they change. So medical education, they have added yoga chapter in their curriculum. What we have changed in our syllabus, that also we need to have a change. So for this, whenever the alumnus comes, you have to talk to them. What is the challenges outside? That is very important thing. Whenever our teachers, you have to call them and ask. What is the, if they go to conference, they have to give the feedback to the office so that we can change. So in education curriculum, always we should be in the limelight. If you are not conducting any programs in the year long, who will know that you are having this much of practice, this much of capacity of potency of this system? So only they will come to know by doing the repeated programs. So there is no bar in the university. There is no bar in the management. Whatever naturopathy colleges they have given to you, and they said naturopathy means no university will object. So they also don't know. You do whatever you like. You form a syllabus. You give the curriculum to the student. That independence we have. Like this, no allopathy or any college in the other system, they don't have this option. Right? So this clearly shows that we have a freedom in the university and in the management. So if you are lazy, then colleges will come down. That's all. This may be any naturopathy college is failure. Today, it's the only principals and the faculty members are responsible. Management and university government is not at all responsible. And one more thing I want to say, this. Okay. Yes. Go on.
Namaste to all. Now it is my time to invite the panel discussion members to the dais. Let me call upon first Dr. John Wardley to the stage. Then Dr. Tina Husser to the stage, please. Please welcome them. Then let me invite Dr. Marutu Raj, Medical Director in Sri Shivalaya Natural Holistic Center. Please come to the dais. Let me introduce Professor Dr. Aklavya Bhora, Dean Yoga and Naturopathy at Dr. Sarvapalli Radhakrishnan in Rajasthan. Please come to the dais. As there is a shortage of timings, my introduction is becoming shorter. Please excuse me for that. Let me introduce Dr. Vanita Shetty, the Principal and CMO of Alvas College of Naturopathy and Yogi Sciences, Mudabidre. Please come, Madam. Let me call Dr. H.K. Gurudat, the founder of Anandamaya Wellness Center, Bangalore. Please come to the dais. Let me call upon Dr. Sarang Patil. Please come to the dais. Let me introduce and call Dr. Banu Kiran. Please come to the dais. Let me call upon Dr. Abhay Shankar Gowda. Please come to the dais. Yeah, after calling upon all the panel members to the dais, please take your seats. I'll hand over the mic to one of my co-chairperson. Thank you.
Thank you, Rajesh. Now that both of us have given the preamble, for want of time, that we needed to have an extensive panel, but at the same time, for want of time, I request each one of you take about a minute and a half or so, or at least maximum 2 minutes. Even then, we would be good half an hour. I think instead of splitting it into opening remarks and then have a round of comments on any particular focused topic that we touched upon in the preamble, and then giving the closing remarks, which is a mandate typically for a moderated panel, I think what we can do today is to wrap your critical observation on one or more of the core areas that we touched upon. Either it could come from your experience, what you have done already, or what you think can be considered to serve one of the 3 educational objectives. And then if time permits, either we can have additional comments or take any questions from the audience. I think we'll hope to finish this session by 1:30. So that's about 35 minutes. So over to John.
Oh, thanks, Dr. Naveen. So I'll just go over your 3 points very quickly with my minute and a half, just to, I guess, highlight what I think important. And you've mentioned, the importance of regulation and standardization, evidence-based treatment, evidence-based teaching, and industry engagement. And, I think one thing that I've just moved into a public university, and the thing in Australia that separates universities from colleges is the requirement to actually engage in the scholarship component, not just research, but scholarship of teaching as well. And that includes everything from, obviously building that evidence base through research, but I think importantly, not just having that pump and dump mentality of getting as many graduates out there, but actually having an obligation to look after those graduates and actually guide new opportunities for those graduates. So, our institution has 3 areas: education, research, and advocacy that we focus on. We engage very, very actively in not just doing submissions to government ourselves, but actually encouraging and actually building into assessments those sorts of submissions for our students. Actually actively engaging students in developing the evidence base. A really good example is we've just had quite catastrophic floods in the area that we are in. We now have a very successful yoga for flood-related trauma and anxiety program, which was initiated by a student project. And so we try and embed work integrated learning into everything that we do. So not just actually collecting data from clinic, but every student has to do a matriculation, a capstone project. And then, what comes after that? So, there's a lot of, we try and embed that back into the teaching and into our advocacy efforts as much as we can. And I think that's the important thing to remember, that students have somewhere to go and actually making those avenues as open as we can. And look, industry engagement is great. We are lucky to be in a comprehensive university, so we have a regenerative agriculture program that we have with us, and we've reached out to the plant science and the ag science sector. We've got projects on the impact of soil health on farmer health. We've got projects on workplace and occupational health and safety in farmers, which is quite an active. So there's a lot of collaborations outside the traditional areas that we've actually engaged with by engaging with industry and finding out what, not going to them with the program, but actually going to them with the question: what can we do to meet your needs? What problems do you have that you haven't found a solution for? And we've been really surprised by some of the partners that are completely outside the normal areas that have actually been actively engaging in that.
Thank you, John. You actually touched upon all the 3 areas, and that certainly a round of applause for you. More so, in my view, as much as I know you for close to a decade now, that John comes from naturopathy education and then move on to a very active academics in very focused engagement with public health. I think relevance to public health and public healthcare delivery is a central focus for any education. And to that extent, I think all the work that you and your universities engaged is very valuable for all of us to, in one or more ways, to emulate. Thank you. Over to Tina. Give us a quick run through of, from the WNF perspective, as to how you see this very diverse naturopathy education that we see, and yet see some common threads that still connects all of us.
Yeah, thank you, Naveen. The World Naturopathic Federation has worked in the last 7-8 years to identify educational programs. We have own committee for that, so I'm co-chairing that committee, educational committee. And we have seen, yes, the challenge is to unify and not to uniform, because each nation, each country has their own educational regulations, and we also don't want to leave someone behind. So there are programs, there are ranging from a few couple of hundred of hours to over 5,000 hours, which the standards you bring in with India are fabulous. So we see that over 50% of all educational programs are 4,000 hours plus, and India takes a big part of it. And over 50% of all educational programs are established in India. So India is a great example for us, even though unfortunately we have no school yet participating in the educational membership. So what we do with the educational membership is we try to homologate, we try to find common grounds, and it has been developed that there will be two main programs. One, the 4,000 hours doctor's program, and the other, a 2,500 diploma program, naturopathic program, which is distinguished in the scope of practice. So the doctor's program is, of course, a program that is more comprehensive in the scope of practice, and the diploma program diverges from that. So, but what our goal is, that schools, to bring up all schools to the minimum 2,500 hours program, but then in the long future, to have a profession that is based on a 4,000 hours plus doctor's program. This will take time. We have brought that also to the associations and the educational institutions to work together, so that the membership association can recognize an educational program and support the school in their countries to really get together and have a common ground in education.
Thank you. The challenges that we face across states in India in many ways are similar to the challenges that WNF faces across countries. And while we are in a transformative stage, it's very important for us to find common grounds for now, for in short term, 3 to 5 years, so that when WHO forms a practice guidelines, we have some kind of a common grounds to cover. And we have now increasingly reaching a stage that we have inter-country exchange, both for education and practice. We have started talking to WNF to recognize our BNS programs, ways and means to adopt that. And the big hurdle therefore would be the educational compatibility between Indian education and elsewhere. So that is where our conversation becomes very important, so that we are not only sensitive to India's needs but to the global needs. So, and as you rightly put, India producing more than 50% of total number of naturopaths in the world. A round of big applause to all of us. I think we should take that leadership so that our physicians are compatible globally. And that's a very, very good insight for us to work on. Keep that in mind while we work towards national integration of our syllabus. There's always been a challenge when we want to bring in advances. And I want to selectively, cutting across the number of experience or seniority, to go back and forth in terms of how we can address this issue. Let me bring the perspective of somebody who has been a teacher, start as a teacher, and somebody who moves on to become the head of the institution and become an administrator. So, Abhay, I want you to give very shortly, in about a minute and a half or 2 minutes max, as to how some of the key problems that you as a teacher or a principal faced could solve in one of the 3 top areas that we touched upon as you became an administrator in the capacity of pro.
Thank you, sir. I was just listening to the first 2 panelists and also the 3 objectives you have given for the discussion today. The solution for all these problems,
hold it this way.
The solution for all the 3 issues what we have in the field of education and practice is what we do is we go in for accreditations. Like NABH accreditations, we already have started for our naturopathy hospitals, but the colleges are still not looking forward towards national, what you call, NIRF ranking, or it is NAC, or it is NBA, or it is World QS ranking, because the education sector is talking about outcome-based education. The curriculum development and how it should be is all outcome-based education now. And also the introduction of NEP 2020 by Honorable Prime Minister Narendra Modi has made it important to know that the education system in India is going to be transformed and it is going to be at par with the world scenario. So when we have to move on further, I think it's more than 35 years that we are into formal education with BNYS, but we have to move on to the next level now by what you call outcome-based education curriculum development. We have to change the curriculum, as well as we have to go in line with the National Education Program 2020, as well as the third thing is accreditation, that is NAC, NIRF and all that. If it's the quantity and quality of information what we give in accreditation, it itself suffices the quality of the education system of that particular institution. Thank you.
Thank you, Abhay. You brought out a very important point, that we are seeking regulation for education and accreditation of institutions, and complying to the accreditation, and if we can do that in our institutional levels and more so wherever possible with the independent universities, a preemptive compliance makes us so ready when we are regulated. So I think all of us working towards these preemptive compliances to the national education policy becomes a very unifying framework for all of us to work within, so that now, like Kerala is coming up with new college for the first time, despite having a large number of physicians all the time. So while we have this opportunity, complying to the national education policy and the accreditation policies that are already in place, sooner or later we are going to be subjected to those regulation. Preemptive compliance is a very important take-home message. Thank you. Again, moving in the same direction, before I get to the more educational perspectives and clinical perspectives from some of us here who are recipient of our education outcomes in terms of physicians, I would want Ekalavya to bring in his perspectives in a very different scenario where you're working. Now again, you have also traversed through career of teaching practice, and now you're part of a university which is a common scenario in this country, where a country which is home for multiple traditional systems, like we are now 6 systems within India, formally regulated and practiced, and inter-Ayush compatibility and inter-Ayush overlap is a challenge for regulators. And to that extent, for us to be very well defined as per our fundamental principles that define us as an independent system of medicine, and to keep that reflected at all times is a challenge in our curriculum. So any step in that direction would be welcome, because either we are independent college or part of an Ayush conglomerate. This has always been a challenge and going to be increasingly a challenge. So your perspectives on that in a short time.
Thank you, Dr. Naveen. एक बहुत ज़रूरी चीज़ जो मैंने देखी है, अभी डॉक्टर अभय ने भी बोला कि हमें एजुकेशन की क्वालिटी पे स्टैंडर्डाइजेशन करना है. आजकल इतने कॉलेजेस आ गए हैं जहाँ एजुकेशन की क्वालिटी तो छोड़िए, हॉस्पिटल्स ही नहीं है. हम एक तरफ तो हमारे कुछ कॉलेजेस हैं जो बहुत हाइट पे बहुत अच्छा काम कर रहे हैं, और कुछ तरफ ऐसे कॉलेजेस हैं जिनके पास मिनिमम बेसिक स्ट्रक्चर भी नहीं. उसकी वजह से जो BN वाइज डॉक्टर्स का जो आउटकम हो रहा है वो उस लेवल का जो होना चाहिए वो नहीं हो पा रहा है. कई कॉलेजेस मैंने ऐसे देखे हैं जहाँ पर प्रॉपर टीचर्स पढ़ाने वाली फैकल्टीज़ जो BN वाइज नहीं है वो पढ़ा रहे हैं. जैसा कि हमने शुरुआत में इस सेशन में भी बोला था कि सेंट्रल रेगुलेटरी नहीं है, तो वो एक सबसे बड़ी प्रॉब्लम है कि हमारे वो नहीं है, उसकी वजह से जो कॉलेजेस हैं वो इतने प्रॉपर वे में नहीं चल पा रहे हैं। एक मैं सभी चीज़ों से यहाँ पे स्टूडेंट से भी कहना चाहूँगा कि जब आप कॉलेज में एडमिशन लेते हैं, आपने एडमिशन ले लिया, आपको डिमांड करना चाहिए कि आपको क्लिनिकल्स के लिए लेकर जाएं। आप अपने टीचर से डिमांड करेंगे हॉस्पिटल की, तो कॉलेज को मजबूरी में हॉस्पिटल बनाना पड़ेगा। बहुत सारे इंस्टीट्यूट ऐसे हो गए हैं जो सिर्फ बिजनेस के लिए BNYS कॉलेज को खोल के चला रहे हैं, तो उनको ऊपर कंट्रोल, एजुकेशन को सुधारने के लिए स्टूडेंट्स की भी जिम्मेदारी बनती है कि वो डिमांड करें कि हमें पेशेंट्स को देखना है, हमें हॉस्पिटल चाहिए। क्योंकि जब तक पेशेंट्स को नहीं देखेगा कोई भी स्टूडेंट, वो अच्छा डॉक्टर नहीं बन पाएगा। दूसरी चीज़ जो हमारी आयुर्वेद यूनिवर्सिटी में मैंने देखा है, जोधपुर के अंदर, वहाँ पे आयुर्वेद के ज़्यादा डॉक्टर्स वगैरह वहाँ पर प्रैक्टिस कर रहे हैं। जब तक हम लोग उस फॉर्म में नहीं आएंगे, जब तक हम में इतना कॉन्फिडेंस नहीं होगा, तब तक हम उनको चीज़ें अपनी नहीं समझा पाएंगे। और कॉन्फिडेंस कहाँ कम हो रहा है? जहाँ पे ऐसे इंस्टीट्यूट से स्टूडेंट निकल रहे हैं जिनको क्लिनिकल प्रैक्टिस नहीं मिल पा रही, प्रॉपर पढ़ाई नहीं हो पा रही। दूसरी एक सबसे इम्पॉर्टेंट चीज़ जो है आज हमारे सिलेबस को लेकर है, हर स्टेट में डिफरेंट सिलेबस हो रहा है। एक सिलेबस है ही नहीं, जो कि पूरे इंडिया में सिलेबस नहीं। उसका भी कारण है सेंट्रल रेगुलेटरी बॉडी नहीं है। तो मैं जितने भी इंस्टीट्यूट जो नए खुल रहे हैं उनको कोशिश करना चाहिए आपस में कि हमें कम से कम 90%, 95% सेम सिलेबस बनाना चाहिए। इवन इन वन स्टेट, if there is 2 universities, deemed universities, both are having different syllabus. We are talking about not all over India. एक ही स्टेट में अगर 2 यूनिवर्सिटीज़ हैं तो उनके भी सिलेबस अलग अलग है। तो हमें इस पे एक बहुत ज़रूरी है, या तो हमें कोई प्राइवेटली या अपने जो भी BNY सीनियर्स हैं, हमें उन कॉलेजेस को कांटेक्ट करना चाहिए जब भी नए खुलते हैं। तो हमें उनको उसके बारे में बताना चाहिए कि कम से कम सिलेबस एक रहे, फैकल्टीज़ में ये रहें। कई कॉलेजेस के अंदर मैं देख रहा हूँ कि वहाँ पर लेक्चर्स में BSc किए हुए लेक्चरर हैं, BNYs है ही नहीं। BMS लेक्चरर हैं, BHMS लेक्चरर हैं, BNYs है ही नहीं। तो जब तक सेंट्रल रेगुलेटरी बॉडी नहीं बन पाती है, तो हमें ये कोशिश करनी चाहिए कि हम लोग उनको अपनी तरफ से, अपने एसोसिएशन की तरफ से उनको गाइड करें, गाइड करके समझा पाएँ। एक इम्पॉर्टेंट चीज़ मैं और कहना चाहूँगा कि चाहे NIN हो या CCRYN हो, हमें जब भी हम कोई कॉन्फ्रेंस करते हैं तो हमें इसमें ये करें कि जिन कॉलेजेस के अंदर प्रॉपर फैकल्टी नहीं है, उन्हें हमारी तरफ से इनविटेशन नहीं दिया चाहिए प्रोग्राम के लिए, एटलीस्ट जिससे वो समझें कि उनको किस अपग्रेडेशन करनी है। बहुत से ऐसे कॉलेज हैं जहाँ BNYs प्रिंसिपल भी नहीं है और हम उनको प्रोग्राम के लिए बुलाते हैं, उनके स्टूडेंट्स को बुलाते हैं। अगर हम उनको बुलाना बंद करेंगे तो एटलीस्ट वो इस कदम में आगे बढ़ेंगे, अपनी क्वालिटी को सुधारने की कोशिश करेंगे। थैंक यू।
Thank you, Ekalavya. You addressed some of the shortcomings and in a formative years of any system of medicine. Imagine ours is the first 100 years of formal education, which was the scenario for MBBS probably 200 years ago. So that doesn't mean that we want to let go or compromise in quality of education. But that said, the cooperative resource pooling is one of the finest solutions that everybody across the world have adopted, and something that we should adopt. And in this regard, National Medical Commission has come up with a very important transformative idea, which I think we talked about preemptive compliance, we should adopt. That is, now if you look at MBBS list of requirements of the infrastructure and faculty for a medical college, which was becoming prohibitive to start a medical college, they have solved it by having a trust wanting or a society wanting to start a medical college can have a collaborative teaching hospital with a completely another society. Now this is something, a very revolutionary idea where you pool the resources. Now likewise, we have large number of yoga and naturopathy hospitals who are very successfully running well. Occupancy is almost 90%, but do not engage in education. That is where these colleges, half of our colleges have come up in last 10 years out of 65 colleges. I would encourage taking cues from you that yes, the best way to fill the shortcomings that come either by virtue of organic development or resource crunch, the best way is to use this, which is very legal option that is available to us, because this will be available for every system of medicine sooner or later, if not now. So this encourages our educational institutions who are already established and even moved on to the post-graduations, start working with those hospitals which are successfully running and make them a teaching hospital formally. So this kind of resource pooling solves a lot of our shortcomings. And that takes me to Dr. Vanita Shetty, who is heralding that kind of growth in education in Karnataka with large number of students post-graduation. And because they are in the high-density naturopathy beds, Jindal, SDM, Parika, this is the kind of situation and a challenge Alvas is facing. And I think straight away you could take this cue and start collaborating with the successful operating hospitals. But that said, Alva has contributed in very differently in solving student advancement, and that is at the end of the day for goal of any college. So Dr. Vanita, I would like you to share with us some of the very innovative steps that you have taken in your institution for student advancements.
So, dignitaries on the dais and off the dais, good afternoon to one and all. So, first of all, we should appreciate the management of all the naturopathy education sector who is taking an initiation to start the naturopathy sectors. And we should also appreciate and give them the way that how we can develop our naturopathy system. Because the other systems, when it comes, there is a lot of scope even in the globally, on the society, on the government sector. But when it comes to naturopathy, especially in some of the states, we are not having a government sectors, government jobs as well. So we all should come together and see that the more and more government opportunities also created so that the public will be benefited out of it. Because the what challenges we face whenever any student comes to us is one part will be then eligibility criteria where it is not on par with across the pan India. And second aspect, whether my son or daughter is eligible to get a government job. So this is the one queries we always take. Now there are a lot of opportunities other than government jobs. They can go into a different sectors. But initiation should be taken from all aspects so that we can give the confidence in every aspects wherever we go. And students, of course, we see the students are gems in all the colleges. Only thing we have to, being a teachers, being a senior naturopaths, we have to mold them in a very better way, getting all the facilities everywhere so that they can survive anywhere confidently and they can bring the naturopathy and yoga into the limelight. Thank you, sir.
Very important point that is touched upon is the journey of the students. Now, to me, this is very important. Unlike any other system, of course, it's true for any traditional medicine, and particularly true for yoga and naturopathy, because yoga and naturopathy physicians are educators as much as the healers that they want to be. So, if you want to be an educator, a health educator of a highest caliber, with all the skill sets available to be a good healer, we have to be an example ourselves. And 5 years is a long time to create a very, very powerful yoga and naturopathy based lifestyle in our own students in our college campuses. It's like jokes of MBBS doctor early days, holding a cigarette and asking patients to stop smoking. Now that applies to us more than any other system of medicine. So I think the colleges in this journey of the students have to create cohorts of highly complying students for yoga and naturopathy lifestyle. Now I think that in itself is a very, very good contribution, other than all the other scholastic activities that we want students to engage in. And thanks for bringing that part. And the second thing that you touched upon is the placement. And placement, I think I'm looking for Dr. Manavalan. He is our go-to person. I think people who take the responsibility of running educational institution have to take placement as an embedded responsibility. Because if you don't take that as an embedded responsibility, then we are doing the half the duty of producing these high quality physicians and not giving them or creating diverse avenues. So that's something that all of us have to, that is where we have to touch upon industry compatible curriculum so that it opens up innovative career. Because we are again a formative system of medicine, we have to invent innovative career pathways. With that, I want to now take some of the combination of observations. Dr. Bhanukiran is one of our senior physicians and now part of our oldest founding colleges in Hyderabad. And you have seen a transition from ND diploma to BNYS, and now Hyderabad is a home for some of the very successful clinical practitioners, particularly in outpatient setting, compared to the norm that we have now made in India as yoga and naturopathy is equal to inpatient or daycare treatment modality. So I'm sure there's a lot of learning back and forth going between these 20, 30 years of successful OP practitioners and the insights that probably you are incorporating in curriculum. So your
Thank you,
thoughts on
Dr.
that
Naveen.
very briefly.
Thank you. Good afternoon to all of you. See, apart from the shortcomings mentioned by the speakers, I would like to add one important aspect which I have observed for the past 20-30 years from my student days. So naturopaths are nowadays more inclined towards modern diagnostic methods. They are depending completely on allopathy reports. Based on that, we are arriving to a conclusion. Whereas from 15-20 years back, Dr. Krishnamurthy, a very eminent doctor from our hospital, he used to first the patient when he comes, without seeing any reports, just he observes his iris. Based on that iris diagnosis, he immediately says that you have this particular problem. Exactly that suits with the reports of the modern diagnosis. So where in this aspect, a lot of confidence develops among students as well as patients. Because nowadays, students are detached from the diagnosis part of the naturopathy. Once you observe the iris changes before the treatment and after the treatment, that give immense confidence among students to practice this naturopathy system. Now, this one aspect is lacking nowadays. What Dr. Naveen is mentioning, evidence-based education. This is the evidence-based education, what I believe. So where the students should get confidence through this education system, what the results is coming by practicing the particular treatment modalities among the patients. So what I feel, one should incorporate this, our naturopathy diagnostic methods, so that the system will be strengthened for future generations, what I believe. Thank you.
Thank you for bringing this very, very important point that can only come from the founding institution of heralding education for more than 5 decades. This takes me back to the 2003 report of ICMR, where ICMR was entrusted by Government of India to define which are the full systems and which are the therapies. The only defining thin line between a traditional method being a therapy or a full system, one of the key questions is, does it have independent diagnostic method? If it has only therapeutic method, it is a therapy. If something has its own philosophy and practice of diagnostics, intervention, measurement and monitoring, only then it is a full system. And fortunately, our forefathers of yoga and naturopathy furnished all of that and it met all the requirements of ICMR, and we were, along with the other 5 systems, became independent full system under Ayush. Now the job is for us to keep that intact. The question is, are we in our educational institutions nurturing naturopathic diagnostic or yoga and naturopathy based diagnostic methods? And how much are we making sure that that percolates into everyday clinical practice? I think this is a very, very important point, and there are people who are here implementing the outcome of education, and Dr. Sarang Patel has inherited a very traditional hospital from his father and brought in a more contemporary education-based clinical practice. And I do know that your practice has been a very good mix of traditional diagnosis, intervention with the wisdom that you apply by virtue of your doctorate in yoga. So how difficult or easy it is, and to be able to generate, if possible, clinical these traditional diagnostics and intervention?
Thank you, Dr. Naveen. As we are discussing here about what are the challenges that are there in our naturopathic education and what are the probable reforms that we could adopt and what are the solutions for us to discuss upon. So one among them is the diagnostic methods, and I have been practicing yoga, naturopathy and various types of complementary medicine modalities together as an integrative medicine since last almost 27 years. And with this experience, what I have observed is that we have a huge scope. In our curriculum, we have learnt everything of most of these diagnostic methods. But again, as doctor had mentioned, application in our clinical practice is something which is very important. Since our education requires that integration, evidence-based education and evidence-based clinical practice. These two are interlinked. Unless we do not have the education, evidence-based education, we do not have evidence-based textbooks. Unless we do not come up with that, education will not have that edge. And once we have that edge, then only we will able to have people or the new graduates coming up with this kind of skill. So application of, as your specific question is, how you are able to apply the traditional naturopathic diagnostic methods. We do use iris diagnosis, the facial diagnosis, we use the encumbrance theory. Of course, we also collaborate with the modern medical, rather I would say modern diagnostic methods, and we are able to successfully produce very good results. So there is a huge body of clinical evidence that we have. There are a number of case studies from simple common cold like a COVID to various types of cancers. We have been able to handle these kind of, manage these kind of various types of diseases successfully. And only the lacuna that we have is the rather documentation and presentation of its in a form of a research paper. I believe in coming days, as now the world has become smaller and we are able to connect virtually with each other, I believe, like often Dr. Prashant used to ask, why don't you come and join us as a visiting faculty often, and then traveling all the way used to be very difficult. But now, since we are able to join virtually from any corner of the world, I believe that we can share and interact our experiences very easily. So this could be one of the way out. Thank you.
Thank you, Sarang. There are ways to solve and keep the feedback from the hospitals to college back and forth active, so that we can keep this real-time progress between the hospitals and the college. Thank you. I think one very important message that come across from what you said is resource generation. And I think we should place on record, NIN has always made quite a few steps, whether it is a compiling a evidence-based textbook, which is available for all of us, and I'm sure all the colleges are making use of that. And so with this combination of NIN producing more and more educational resource materials and methods, and CCR1 engaging in more and more evidence generation and dissemination of evidence, I think this support that is available for us in these two autonomous institutions is something that we have to real-time use in every educational institution to fill those gaps. But there's a lot more to be done. I think every faculty, every department in medical, in our colleges, should focus now on a very high quality structured resource material for our education. I think that's one area that we have not been able to focus sufficiently. I think that's something that we can all take home as a first priority assignment. But again, Dr. Marutraj has been one of those very few, I must say, in the early days to hold on to very traditional practice in medical settings. So he brings the know-how of conventional medicine, aware of his own personal experiences, interaction, and his education in pharma, and in his experience in medical setting, and keeping this balance of traditional yoga and naturopathy practice in medical setting. In fact, I was so much interested on my way to Sadhguru's ashram for doing research. I took time to spend a couple of hours in his place because I was so interested in those days, about 15, 18 years ago, how is somebody, one of our own, is integrated in a medical setting. So you have a lot of learnings as an individual, and I think that learning, if you can just put us in one or two points, something that we can take back to colleges.
Thank you, Dr. Naveen, and thank you for the opportunity. To be honest, the August Forum have spoke a lot of good points, and they brought up a lot of insights and in between the lines. But if I say when we want to standardize the education program, then it's based on a triology. It should be a teacher, student, and the beneficiary. So when you take into that, so the thing is that the problem is that our textbooks still, other than the conventional system of medicine, and otherwise our therapeutic textbooks, they're still ancient and not supported with the quality research. So the well evidence-based content which has to be delivered to the teachers, that has to be, once again, it's a kind of loop between the research fellows and as well as the teachers. And also, I think I suggest one model, that a continuous training program among the teachers, like organizing a conference like this, organizing a conference exclusively for the teachers and train the trainers program, which sharing of the experience, and that is very important. The another thing is that the student, when we come to our system of medicine, unlike other system of medicine where the doctors or the medical student who are studying the system cannot undergo an experiential, that they cannot experience the system, where our system has a wonderful opportunity to experience the system right from the beginning. That experience makes you more confident, and you develop a lot of conviction and taking the system forward. And once again, the final is that the beneficiary is the end user, is the patient. So here, what happens most of the time, as Dr. Naveen rightly pointed out, naturopathy in the sense you need a 20-bed hospital minimum or a 30-bed hospital with a great infrastructure of more than 50 lakhs to 1 crore. That itself makes the naturopathy doctor to lose their confidence. So what I feel, one can able to survive in a 10 into 10 room just by consultation and minimum prescription of treatment. We can do wonderful things. That what happened to me. As Dr. Naveen said, that I was working in a conventional hospital. That was a great challenge. But what helped me to practice at par with them, and even I become the honorary physician for the honorary medical practitioner membership in IAA, Indian Medical Association in Erode chapter. The reason is that
if you are strong with the basic medical science and if you are able to put across your system of medicine in a scientific way and how we are going to bring change in a patient with diabetes mellitus or obesity or PCOS, so that is much more important when no one is treating you as inferior, provided you are adequately educated and adequately you have a proper clinical knowledge and able to put the things across in their language. It is very important because you cannot expect a conventional practitioner to understand based on your Panchamaga Buddha theory or morbid matter theory or anything else. The same way, Dr. Bhanukiran has said a very wonderful thing is that the traditional way of diagnosis. See, we can standardize our traditional system of diagnosis because the first thing to develop in a human, that is when once an embryo is formed, the first thing is to develop is the iris, the neuroectoderm which leads to the formation of iris. So definitely most of the organ definitely connected to the iris and which we can make a diagnosis based on the iris. So very importantly in the beneficiary part, that the patients, see what happened, most of the patients who come to a naturopathy center, they undergo a program of 7 days or 10 days or 21 days. But what they take home, it is missing. They go back and they have the same set of lifestyle and again they come back to the institution. So it become a kind of a customer-client, customer relationship like that. So our system is unique, which is preventive and as well as curative, and we have to empower the society such a way that they can prevent most of the non-communicable disease. In other ways, it also improve the productivity of the nation and development of the nation because the medical burden on the society will be, the medical expense burden on the society will come down. In turn, it will improve the productivity of the citizens. So these are the points which I like to highlight. Yeah.
Thank you. I know you have a lot to share. More you fight, more you want to share so that the others don't have to go through the same trouble. I understand that, but I think the two important messages I think that we should focus on from your experience is that medical compatibility of the education makes us more relevant and capable of integration. That's something we all agree on, and number of all the presentations in this conference, I think students are having a very, very progressive presentations of evidence-based contemporary relevance of our traditional philosophies. And I think this conference has been a very great example of that, thanks to CCRY and Dr. Raghavendra and his team. The second thing that I would like to focus on is faculty development program. Again, National Institution of Naturopathy under Dr. Satyalakshmi has taken decisive steps, but I think there's a lot more that we can do. Subject-wise, now this is something that I have been talking about, that we have 64 colleges, which means there are 64 people full-time engaged on a given subject. If these 64 people for a given one subject, let's say hydrotherapy, meet once a year with some both traditional and conventional faculty to have a very structured faculty development program, I think that's the best and fastest way of us becoming medically compatible teaching. We work more closely with NIN to make this happen, and I'm sure the colleges have to again do the follow-up and get this happen and participate. Finally, I come to everything stops for us now is regulation and accreditation. The accreditation goal is to ensure the quality, ensure the end outcome for a student who walks in at the age of 18, comes out as a very, very responsible physician at the age of 22. So Dr. Vinay Ambarkar has been in the other side. He's been an accreditor or a registrar who spent his couple of years registering all Ayush doctors in Karnataka. So you have seen the gray areas in other Ayush systems, and do we have any learning from the other way across the table that you would want to see our colleges to adopt immediately so that some of those challenges are taken care of whenever, as early as possible, when we are subjected to regulation?
Thank you, Naveen. Almost all the speakers have spoken about a lot of things about the syllabus and how it should be. I would like to just concentrate on two things. One is that all the colleges in India, they should have a uniform syllabus code, so that wherever you go, whichever student comes out, whosoever question, they should answer in only single way. Like, for example, when I was a registrar in Karnataka Ayurveda and Unani board, I used to get students from different colleges. And for the same question, I used to get different answers. Maybe there are few colleges who taught them well, or maybe there are few colleges who didn't even teach them that subject properly. So the uniformness in the syllabus across the nation is very important. And the next thing is CM is continuous medical education. Medical education is not a stable thing. It is changing every second, every minute, every hour. So whatever is changing, whatever the evidence is coming up in all the research projects, what the researchers are conducting, that should be implemented in the syllabus. And see that the syllabus is changed accordingly, or a committee should be formed every year or once in 2 years to see that the syllabus is modified accordingly. And that's all what I wanted to say. Thank you.
Thank you, Vinay. A registrar job is pretty much like a mock accreditator. Now, when we get the accreditation, that's pretty much what they would look for. Is there a common minimum standards across the institution, regardless of their proficiency, scale, and longevity of the college? I think that's something that we all agree on and have to work. But point remains, we have also again are subjected to disadvantages of formative years, but we are also enjoying the advantages of formative years. In naturopathy practitioners across the world, like any other medical practitioners, are subjected to medical legal cases. There are patients who have taken them to court. Now, thankfully, in the formative years, we have not gone to that, except some of the quacks here and there are caught deservedly. But qualified yoga and naturopathy physicians have not subjected to any of those unfortunate circumstances. The goal of accreditation is to make sure that we are equipped for those medical legal circumstances. And that is a singular goal of institutional accreditation. I think there are lessons in that regard for us to learn from, and our own physician having a first-hand experience in years to come, it will help us. Thank you. Now, one last point. I know we are already 140 plus. I think we have one critical point to cover, and that is naturopathy in India. Because we are an embedded mind-body medicine with yoga and naturopathy, unique to anywhere in the world, we conform to the best psychosomatic template of mind-body medicine. And in that pursuit, we have a very unique combination of therapies. Now, in China, acupuncture is a standalone therapy or a system. And elsewhere in the world, because China propagates and propounds it as an independent system, all over the world, it is an independent system. Naturopaths across the world do not include acupuncture as part of drugless therapeutic modality. And in India, we have that luxury because it conforms to the drugless template. And Dr. Gurudat is someone who has pursued that path, extensively uses, and thank you. Like Pradeep, who is giving proficiency in research, evidence-based practice and teaching to our students and fellow physicians, Gurudat has been engaged, other than his clinical practice, in bringing some of the best minds in acupuncture to India to give us that proficiency. Now, we have to live with this challenge that there are people who wants to see acupuncture out of naturopathy as a standalone, but points remain that acupuncture practice as an inherent therapy within the template of yoga and naturopathy is working. And if you have to give us some message to the colleges to incorporate those advances or advantages that you are trying to give through these CMEs inherently in our UG education, so that we are equipped to continue acupuncture as part of yoga and naturopathy therapeutic template? Your thoughts on that?
Most of the speakers have already spoken so much about our shortcomings and what we want to do about our education and everything. It was the biggest challenge for me when I came out of the college to which kind of OPD setup we have to do. Acupuncture came to my help. The simple reason for that is the basic principles of acupuncture based on 5 elements and its traditional concepts of yin and yang confirms with naturopathic system of medicine. So that was the inspiration for me to go along. What was happening in our present colleges about acupuncture is, it's a reductionist approach kind of a teaching. That has to change. In the sense, why don't we get the concepts of naturopathic principles which are in conformation with TCM principles and try to see both of them parallelly and thereby come into a situation wherein we can plan the treatments accordingly. Many of the treatments, for example, simple diabetes is a metabolic syndrome. We all know that about it. In traditional perspective, the metabolism is linked to earth element in terms of TCM. So we have to look into that. Diagnostics has to happen through that perspective. So that is the challenge what we have to face. And if we can bring about that concept integrated in our education system, that will aid a lot of students to look into OPD practitioner. We cannot look into students coming out of so many colleges today in India to always look for institutional practice. We have to look into private practice. A system grows very well when the private practice becomes very strong. So that is most important. Acupuncture comes to our help. That it is very fair in our naturopathic principles, bring in those concepts and bring in those concepts into our education system for all the students to learn about it. So that it brings in a lot of confidence. At the same time, one more important aspect which I find is communication between the student, between the practitioner and the patient. Only when our philosophies and the science is bridged well in our colleges and confidence is given about that and you start believing it and trusting it. One of the important points many of the panelists spoke about is you practice what you preach. That very apt for our system. So if that is the case, we have to work on how we can integrate our concepts into our life and then build in trust and confidence when we speak to the patient, communicate the same thing, and trust and faith heals. We speak a lot about it. If that has to happen, we have to build ourselves into that. For that, education becomes very important when we have to focus on the clinical aspects of traditional clinical tools. It may be a tongue diagnosis or a pulse diagnosis. Other panelists spoke about iris diagnosis. Acupuncture brings in tongue diagnosis and pulse diagnosis. Way across the world, there are several papers today to mention about the changes which happen on the tongue before and after the treatment, pulse changes before and after the treatment. Why don't we bring those concepts into our education system, build in the confidence for our students and equip themselves to go out of the college and have private practice is one of the most important options. One of the tools what they need to have, not look just only for traditional institutional practice. This is what I would like to want. In that perspective, I am looking at people who can bring in that value into our practitioners and organize CMEs for them to understand this and integrate into their practice. That's the thing which I would like to do and I've been doing.
Gina wants to just add a sentence to what.
One of the first questions when we have been with the WNF at the WHO Department for TNCM was by Dr. Chang Chi. What is the difference when you as a naturopath apply acupuncture and a TCM therapist applies acupuncture? And our answer was very clear, it's the assessment. The naturopathic concepts we include when we do acupuncture.
Thank you. I think both of you concur the same very singularly important point. Along with using acupuncture as a therapy, acupuncture or TCM's philosophy lends itself to be amalgamated so much in sync with naturopathic philosophies and practice. And I'm glad to hear from Tina that that is the approach that across the world naturopaths are adopting to embrace acupuncture in their practice, both in the assessment, embedding the philosophy and intervention. Thank you. So that comes to, I guess, everybody's bit to what we want to say for education. We are well beyond the time, so I am sorry, I don't want to get everybody's closing comments about what we want to do. I think we've very, very thankfully everyone kept their comment and something that we want to go back and work on. Thank you for adding all of that in your 2-minute presentation. I want to take this opportunity to thank CCRYN for putting up a very, very structured program covering all of the areas so well, and I'm sure the presentations and the panel discussions leaves us a lot to think and to go back and work on. And I think the goal is to keep this connection between the institutions and everybody, be it a clinical practitioner, an institution or a university, to stay and use these two autonomous pillars, CCR1 and N, to our advantage. And we have two best academicians heading them, and we are seeing the results of that. I think if we keep doing this, preemptively we are ready for a national regulation. With that, I would want to close this panel. Rajesh has not spoken, so I would want Rajesh to give a concluding remark as to how he is our longest serving physician with a personal embedded OP daycare practice and now heading an institution. So Rajesh, you are the right person to sum up all that is said by everybody and give us a 2-minute closing remarks to this panel.
Dear co-chairpersons and panel members, it is my privilege to give the closing sessions. As Dr. Naveen told, as a clinician, as a daycare provider, as a CMO and principal, in my experience, what I come across is, as other Ayush system of medicines are there, we should have a standard MSR. That is our opinion in this panel. That is minimum standard requirement to establish a college and also to establish a teaching hospital. I'm not talking about other hospital. To establish a college and teaching hospital, there should be a standard MSR throughout the country. Okay. The second one is a standard MSE, minimum standard education, where, as the panelists were pointed out, and it's uniform syllabus, uniform eligibility for admission to the course, duration of the course, internship programs, house surgency programs, and finally the placement, everything. And even the salary of the staff, the positions there, how many professors should be there, how many assistant professors, everything will be covered in MSCs. Therefore, my closing remark will be, we should form a proper, already it's formed by some institutes. MSR and MSc is very important, at par with other Ayush systems of medicine, and there we can bring a quality in education and research and all the faculties. Thank you.
Thank you, Rajesh. Although this happens to be the closing remark, I want to add a sentence to what you said. I think we are all very aggressively seeking national regulation. And if we are willing to seek a national regulation, we have to comply. And I think one thing that we have not been able to comply, or not wanting to, or wanting more time to comply for various administrative institutional reasons, I think we have to take a stand as a collective community that we should sooner or later be ready to get under NEET. Now, if we want to comfortably be out of NEET and then want a regulation at par with Ayush, that's not going to be something palatable to the government. So you have to bite the bullet. I think take all the insights of this beautiful panel, and I request all the management and principals to work towards making our institutions compatible for the next year NEET. If we start seeking even that, then that is a testimony that we are ready for regulation. So with that, I thank everyone once again, all the learned fellow senior faculty, and I must give a round of applause for all the students. Lunch time 1 to 2, not a single student moved. Thank you, and I'm so glad you enjoyed it. So with that, over to you for closing this panel.
Thank you so much to all the panelists and the discussion. It was quite insightful to see how we can actually fabricate and tailor everything that is happening in the field of naturopathy, as it is going to help us students in the near future and the naturopaths who are currently serving and working. Thank you so much. It's time we felicitate all the panelists. I would request Dr. Naveen KV to please felicitate Dr. Ekalavya, Dr. Vanita Shetty, Dr. Gurudatta and Dr. Bhanu Kiran. A huge round of applause, please. Dr. Ekalavya. Thank you so much. Now would request Dr. John to please felicitate Dr. Ambedkar, Dr. Rajesh Padikal and Dr. Praveen Shetty. Thank you so much to all the panelists on the dais. Would request all of them to please get off stage. Thank you. Would request all of them to please have their lunch and report back by 2:30. Happy lunch.